ಎಲ್ಲರಿಗೂ ಶುಭ ಮುಂಜಾನೆ. ಗುರು ಪೂರ್ಣಿಮೆಯ ಸಪ್ತಾಹದ ಶುಭ ಸಂದರ್ಭದಲ್ಲಿ ನನ್ನ ಹಾಗೂ ಎಲ್ಲ ಆಯುರ್ವೇದ ವಿದ್ಯಾರ್ಥಿಗಳ ನೆಚ್ಚಿನ ಗುರುಗಳಾದ ಡಾಕ್ಟರ್ ಮಾಧವ್ ಡಿಕಾವಿ ಸರ್ ಅವರನ್ನು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತಿಸುತ್ತೇನೆ. ನಾವೆಲ್ಲ ನಾಗೂರ್ ಕಾಲೇಜಿನಲ್ಲಿ PG ಮಾಡುತ್ತಿರುವಾಗ ಚರಕ ಅಧ್ಯಯನವನ್ನು ಹೇಗೆ ಮಾಡಬೇಕು ಎಂದು ಗೊತ್ತಿರದ ಸಂದರ್ಭದಲ್ಲಿ ನಮಗೆ ಸಿಕ್ಕ ಗುರುಗಳ ಮಾರ್ಗದರ್ಶನ ಅತಿ ಅಮೂಲ್ಯವಾಯಿತು. ಅವತ್ತಿನಿಂದ ನಾವು ಮಾಧವ್ ಡಿಕಾವಿ ಸರ್ ಅವರ ಮಾರ್ಗದರ್ಶನದಲ್ಲಿ ಚರಕ ಅಧ್ಯಯನವನ್ನು ಪ್ರಾರಂಭಿಸಿದೆವು. ಅದಕ್ಕಾಗಿ ನನ್ನ ಸನ್ಮಿತ್ರ ಡಾಕ್ಟರ್ ರಾಹುಲ್ ಕುಲಕರ್ಣಿ ಅವರು ಚರಕ ಕಲ್ಪಸ್ಥಾನದ ವೆಬಿನಾರ್ನಲ್ಲಿ ಮೊದಲು ಡಿಕಾವಿ ಸರ್ ಅವರಿಗೆ ನಮಿಸಿ ಪ್ರಾರಂಭಿಸಿದರು. ಇದಲ್ಲದೆ ನಮ್ಮಲ್ಲಿ ಅನೇಕ ಬ್ರಾಂಚ್ಗಳಿತ್ತು. ಸ್ವಸ್ಥವೃತ್ತ, ದ್ರವ್ಯಗುಣ, ಕಾಯ ಚಿಕಿತ್ಸಾ, ಈ ರೀತಿಯ ಅನೇಕ ಬ್ರಾಂಚಸ್ಗಳಿದ್ರೂ ಸಹಿತ ಸರ್ ಕಾಯ ಚಿಕಿತ್ಸಾ ಗೈಡ್ ಅಷ್ಟೇ ಅಲ್ಲ, ನಮಗೆಲ್ಲರಿಗೂ ಸಹಿತ ಡೆಸರ್ಟೇಷನ್ ಅನ್ನ ಹೇಗೆ ಪ್ರಾರಂಭಿಸಬೇಕು ಮತ್ತು ಹೇಗೆ ಸಮಾಪ್ತಿ ಮಾಡಬೇಕು ಅಂತ ಒಂದು ರೂಪವನ್ನು ತಂದುಕೊಟ್ಟರು. ಈ ರೀತಿಯಾಗಿ ನಮಗೆ ಅನೇಕ ಸಂದರ್ಭಗಳಲ್ಲಿ ಡಿಕಾವಿ ಸರ್ ಅವರು ಮಾರ್ಗದರ್ಶನವನ್ನು ನೀಡಿರುತ್ತಾರೆ. ಈ ಕಾರಣದಿಂದ ನಮ್ಮ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೂ ಸಹ ಅವರ ಮಾರ್ಗದರ್ಶನ ಅತಿ ಅವಶ್ಯಕ. ಆದ್ದರಿಂದ ಈ ದಿನ ನಾವು ಅವರನ್ನು ಈ ವೆಬಿನಾರ್ ಸಿರೀಸ್ಗೆ ಬರಮಾಡಿಕೊಂಡಿದ್ದು. ಈ ರೀತಿಯಾಗಿ ನಾವು ಮಾರ್ಗದರ್ಶನವನ್ನು ನೀಡಬೇಕೆಂದು ಕೇಳಿಕೊಂಡಾಗ ಸರ್ ಒಪ್ಪಿಕೊಂಡಿದ್ದು ನಮಗೆಲ್ಲರಿಗೂ ಸಂತೋಷದ ವಿಷಯ. ಆದ್ದರಿಂದ ಅವರಿಗೆ ಈ ವಿಶೇಷ ಸಂದರ್ಭದಲ್ಲಿ ವಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತಾ, ನಾವು ಐ ರಿಕ್ವೆಸ್ಟ್ ಮಿಸ್ Anshu Sharma to give a welcome speech.
A very good morning, everyone. I heartily welcome you all to today's webinar, Tatvaprabodhini. I, Anshu Sharma, a second-year student of Government Ayurveda Medical College, Mysore, will be introducing today's guests to you all. It's my pleasure to start this occasion by welcoming our principal, Dr. Gajanan Hegde sir, who gave us an opportunity to conduct this webinar. Now, I would like to welcome and introduce our speaker today, Dr. Madhava Diggavi sir, who will be giving us the guidelines in understanding Charaka, Samhita and Sutra, Sthana. Dr. Madhava Diggavi sir is a well-known teacher of Kaya Chikitsa. He is also recognized for his immense knowledge in Samhitas. A huge number of students are being impressed by his teaching that an AIPGT coaching center, Madhava Forum, has been named after sir's name. Sir has been giving guest lectures in many national and international seminars. He has a great number of articles published by his name. Today, it's a privilege for us to have such a wonderful teacher with us here. I further welcome the event advisor, Dr. Shivatsu sir, the organizing secretary, Dr. Vasudev Chate sir, and the coordinators of today's event, Dr. Ashwini ma'am and Dr. Ramesh sir. I would further like to extend my welcome to the staff and students of GAMC Mysore. Your active participation throughout the session will be highly appreciated. Thank you.
Thank you, Anshu. ಇದಲ್ಲದೆ ಈ ವೆಬಿನಾರ್ಗೆ ರಾಜ್ಯದ ಮತ್ತು ರಾಷ್ಟ್ರದ ಅನೇಕ ಕಾಲೇಜುಗಳಿಂದ ವಿದ್ಯಾರ್ಥಿಗಳು, ಶಿಕ್ಷಕರು ಭಾಗವಹಿಸಿದ್ದು ಅವರೆಲ್ಲರಿಗೂ ಸಹಿತ ನಾನು ಈ ಸಂದರ್ಭದಲ್ಲಿ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತಾ, ನಮ್ಮ ನೆಚ್ಚಿನ ಪ್ರಾಚಾರ್ಯರು ಹಾಗೂ ಈ ಎಲ್ಲ ವೆಬಿನಾರ್ಗಳಿಗೆ ಮಾರ್ಗದರ್ಶಕರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಗಜಾನನ್ ಹೆಗಡೆ ಸರ್ ಅವರು ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಮಗೆ ಕೆಲವೊಂದು ಹಿತನುಡಿಗಳನ್ನು ನೀಡಬೇಕಾಗಿ ಕೋರುತ್ತೇನೆ.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಕೇಳಿಸ್ತಾ ಇದೆಯಲ್ಲ? ದಿಗ್ಗಾವಿ ಅವರೇ ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ ಸರ್. ನಮಸ್ಕಾರ.
ಕಾಣಿಸ್ತಾ ಇದೆಯಲ್ಲ?
ಕಾಣಿಸ್ತಾ ಇದೆ ಸರ್.
ಓಕೆ ಸರ್. ಸೊ ನಮ್ಮ ಕಾಲೇಜಿನ ವತಿಯಿಂದ ಪ್ರತಿಯೊಂದು ವಿಭಾಗಗಳಿಂದಾನೂ ಕೂಡ ಸಿರೀಸ್ ಆಫ್ ವೆಬಿನಾರ್ಸ್, ಸಿರೀಸ್ ಆಫ್ ಗೆಸ್ಟ್ ಲೆಕ್ಚರ್ಸ್, ಅಪಾರ್ಟ್ ಫ್ರಾಮ್ ರೆಗ್ಯುಲರ್ ಕ್ಲಾಸಸ್ ವಿ ಆರ್ ಕಂಡಕ್ಟಿಂಗ್. ಅದರಲ್ಲಿ ನಮ್ಮ ಎಲ್ಲ ವಿಭಾಗಗಳಿಂದಾನೂ ಕೂಡ ನಮ್ಮ ಅಧ್ಯಾಪಕರುಗಳ ಪಾತ್ರ ತುಂಬ ಹಿರಿದಾದದ್ದು. ಮತ್ತು ವಿಶೇಷ ಅಂದರೆ ಕೇವಲ ನಮ್ಮ ರಾಜ್ಯ ಮಟ್ಟದ ಅಥವಾ ಝೋನಲ್ ಲೆವೆಲ್ ಅಷ್ಟೇ ಅಲ್ಲದೇನೆ ರಾಷ್ಟ್ರೀಯ ಮಟ್ಟದ ವಿಚಾರ ಸಂಕಿರಣಗಳನ್ನು ಮತ್ತು ರಾಷ್ಟ್ರೀಯ ಮಟ್ಟದ ಸಂಪನ್ಮೂಲ ವ್ಯಕ್ತಿಗಳನ್ನು ನಾವು ಈ ವೆಬಿನಾರ್ ಸಿರೀಸಲ್ಲಿ ಜೋಡಿಸ್ಕೊಂಡಿದ್ದು ನಮಗೆ ತುಂಬ ಹೆಮ್ಮೆಯ ವಿಷಯ. ಲೈಕ್ವೈಸ್ Dr. Madhav Diggavi is a well-known resource person and also a recognized clinician of our Karnataka and our nation. And he is our Ayurvedic ambassador, what I can say. And I would like to welcome him on behalf of our institution and our staff, and also on our state, on behalf of our state. ಅಲ್ಲದೇನೆ ವಿ ಆರ್ ಪ್ರತಿಯೊಂದು ಡಿಪಾರ್ಟ್ಮೆಂಟ್ಗಳಿಂದ ಅದರಲ್ಲೂ ವಿಶೇಷವಾಗಿ ನಮ್ಮ ಕಾಯ ಚಿಕಿತ್ಸಾ ವಿಭಾಗ, ಸಂಹಿತಾ ಸಿದ್ಧಾಂತ ವಿಭಾಗ, ಪಂಚಕರ್ಮ ವಿಭಾಗ ಮತ್ತು ಸ್ವಸ್ಥವೃತ್ತ ವಿಭಾಗ, ಈ 4 ಸ್ನಾತಕೋತ್ತರ ವಿಭಾಗಗಳಿಂದ ವಿಶೇಷವಾದಂಥ ವೆಬಿನಾರ್ ಸೀರೀಸ್ಗಳನ್ನು ನಾವು ಆಚರಣೆ ಮಾಡಿದ್ದೀವಿ. ಎಲ್ಲ ಮುಖ್ಯಸ್ಥರುಗಳಿಗೆ ಈ ಸಂದರ್ಭದಲ್ಲಿ ನಾನು ಅವರನ್ನು ಅಭಿನಂದಿಸ್ತೇನೆ. ಹಾಗೇನೆ ಐ expect same cooperations and coordination from all the resource persons who are taking part in the webinar series which are conducting by our institution. Once again, I would like to welcome and also congratulate my friend Dr. Madhav Diggavi. Over to organizers.
Thank you, sir. Thank you so much for your supportive and inspiring words. Now I request Dr. Madhav Diggavi, sir, to continue the session. Sir, please continue the session.
ಇದು ಮಾಡ್ಬೇಕು. Shri Gurubhyo Namaha Hari Om. Most respected Principal of Government Ayurveda College, Mysuru, and Dr. Gajanan Hegde, sir was my senior in my undergraduate studies. They are my inspirators with their mentorship and blessings. Today I am here with you. My salutes to C. Dwarkanath Guruji, who hails from Government Ayurveda College, Mysore, and all the legendaries of Ayurveda. Ragadi Rogan, Satatan Shetan, Aseshakaya Prasatan Aseshan, Autsukya Moha Ratidan Jagana, Yo Purva Vaidyaya Namostu Tasma. With great salutes to Acharya Charaka, Acharya Chakrapani, and with his blessings, today let me try to have some inputs for understanding Charaka Samhita, especially Purvartha today. Understanding of Charaka is unlimited. In one session, I think I cannot explain all the things what I want to tell, but few of the areas I want to cover are the beginners. This lecture is not for experts in Charaka Samhita. It is only for the beginners in Charaka Samhita, students of Charaka Samhita. Once again, I am thankful to the organizers, Dr. Vasudeva Chate, for his passion of learning Charaka, and he has got a lot of respect and love for me. And head of the Department of PG Studies in Samhita and Siddhanta, Dr. Srivatsa, one of my friend, and all the faculty members of Samhita and Siddhanta Department of Government Ayurveda College, Mysore, all teaching faculties of the college, postgraduate scholars, and my dear students. The aim of understanding this is to throw glimpse on classical book Charaka Samhita. We can keep one or two objectives of this presentation to historically review the literature available on Charaka Samhita, to show the important contribution of Acharyas in understanding Charaka Samhita. This presentation of the book is like this. If you open the book, what it is a question in front of the beginners. This Charaka Samhita is presented in the form of it as a record of proceedings of a seminar or a debate. This is Guru Sishya Prashna Uttara Parampara. Agnivesha asked some question and Atreya Punarvasu is giving answer, and this is documented by Agnivesha Pratetantra. It is a dialogue between teacher and his disciples. Even though there were 6 disciples asking questions and answering, the leader was Agnivesha. As a narrative of instructions, what instructions given by Acharya Charaka is narrated in this book called Charaka Samhita. Charaka Samhita is a fundamental textbook of Ayurveda. The readers of this Samhita should love Acharya Charaka, should love Agnivesha, should love Atreya Punarvasu. If you love Charaka Samhita, you start understanding its internal meanings. In between the line, understanding develops. Charaka Samhita has got 8 sections and totally 120 chapters are there. Charaka Samhita is primarily a text of Kaya Chikitsa Pradhana Tantra. Acharya Chakrapani explains it clear in the first chapter itself. Charaka Samhita explains the basic principles of Ayurvedic science for healthy living. So, Adhyupadeshta is Punarvasu Atreya. These are all PG entrance questions. Students must be carefully understanding this. Adhyupadeshta is Punarvasu Atreya. Tantrakarta is Agnivesha, who hails from 1000 BC. Pratisamskarta is Acharya Charaka, 2 to 3 century BC. And Sampuraka is Drudabala. If you see some aspects of Charaka Samhita, it describes the principles of Ayurveda, mainly Panchamahabhuta Siddhanta, Tridosha Siddhanta, Sapta Dhatu Siddhanta, Ahara, Prakriti, Agni. And its 8 branches of Charaka Samhita, Kaya Bala, Grahurtvanga, Shalyadamstra, Jaravrushan, all these 8 branches are explained in different way in this Samhita. And Charaka Samhita emphasizes on promotive and preventive measures for health. What are those preventive and promotive health measures in Charaka Samhita? Number 1 is Dinacharya. See, Dinacharya we have lost. I am not telling that Dinacharya I may be doing, or one person may be doing, or 10 people may be doing. It's not enough. In the entire country of India, we have missed Dinacharya protocol. That's why we are suffering with pandemic viral infections. Rutucharya and Ratricharya. There are 2 things which are to be followed as per the season. Now we are running Varsha Rutu. Varshasu Chiyate Pittam and Vatam Prakupyate. So according to the Vata Prakopa and Pitta Sanchaya, we should develop our lifestyle, we should develop our clothing, we should develop our diet, we should develop our Vyayamacharya, and then we are able to have a good immune system. But we are missing this. I don't know how many are following Rutucharya and Ratricharya in the current scenario. So our immunity is not good, and hence we are prone to get pandemic illnesses. Sadvrutta. Sadvrutta is not at all seen because of this composed lifestyle, westernized lifestyle, and we have forgot our Sadvrutta of ancient time. Rasayana, Achara Rasayana, we have once again Achara Rasayana is equal to Medya Rasayana, equal to any Pranakamya Rasayana or any Rasayanas. And without Achara Rasayana, any Rasayana Ushadhi is incomplete. So we are not following Acharya Rasayana, supposed to get definitely immune suppression. So we are having Kavagunya due to the not following of these emphases made by Acharya Charaka. And it is the teaching that From today, if we start understanding Dinacharya, Ritucharya, Ratricharya, Sadgurupta and Achara Rasayana, definitely we can conquer the pandemic disease. The rational classification of dravyas and description of 50 groups of drugs based on their actions and use is explained in Acharya Charaka Samhita, Sutra Sthana 4th chapter. Therapeutics of single drug, simple combinations and special combinations, that is Aushadhi Yoga Kalpas for curing various diseases has been explained in Acharya Charaka by Acharya Charaka. Methods of clinical examination is also explained in Charaka Samhita. Darshana Sparshana Prashnaihi Parikshetcha Rogina. Assessment through Yukti is also discussed. In Sutra Sthana 2nd chapter, Acharya Charaka says, Yuktistu Yojana Yatu Yujyate. This planning, this calculation is very important for any Vaidya. If Yojakas Tatra Durlabhaha, the planning person is actually not available in our scenario. That's why we are suffering. If a right planning person is available, we can get all benefits told in Charaka Samhita. He explains some of the ethics and basics of medical practice in Sutra Sthana. He also explains about our registration issues, the permission taken by Raja before we start practice, and in some of the diseases, we also should take permission of the patient attenders and king, and then we should give treatment, as it is in Visha Prayoga of Udara Roga. Detailed description of almost every known disease is given. Acharya Charaka explains the disease firstly by its definition, then synonyms, then causes, etiopathogenesis, and Chikitsa Siddhanta. Patya and Apatya are also explained, and prognosis of the disease is also explained in this Samhita. Some of the salient features I want to highlight are like first Bruhatrayi, major text of Ayurveda is Charaka Samhita. The first among three Bruhatrayis is Charaka Samhita. 9,295 sutras are explained in this book. 11949 yogas, medicine kalpas are explained in this Samhita. 12,000 shlokas, about 9,498 are available now. These many shlokas have been explained. 12,000 shlokas have been explained. There are more than 41 plus Sanskrit commentaries on Charaka Samhita. More than 41 commentaries are available. Few of them are published, few of them are unpublished. So it is our duty to bring out all commentaries of Charaka Samhita under one roof. There are Hindi translations, regional languages like Kannada, Telugu, Malayalam translations, English translations, and Western language translations are also available. By Charaka Samhita, we are getting immense benefit and its acceptance even in 21st century also. What Charaka has deliberated in 200 BC are still working. The medicines are still working. The concepts are still applicable. So still Charaka Samhita's words are practicable. That is its salient feature. If you can see what are the commentators and commentary written on Charaka Samhita, Bhattara Harishchandra has written Charaka Nyasa in 14th century AD. Acharya Jajjata has written Nirantara Padavakya in 6th century AD. Acharya Chakrapani has written Ayurveda Deepika, very famous and routinely used commentary on Charaka Samhita. He is from 11th century AD. Acharya Gangadhara, he has written Jalpa Kalpataru in 19th century AD. Acharya Yogindranath Sen from the Bengal and West Bengal concept of Ayurveda. It was a very rich Ayurvedic tradition in Bengal. Acharya Yogindranath Sen has written Charakopaskara, 20th century AD, which is the recent and last most commentary on Charaka Samhita. We should understand 8 sthanas of Charaka Samhita and 120 chapters. This is also one of the PG entrance question. Sutra Sthana having 30 chapters, Nidana Sthana having 8 chapters, Vimana Sthana having 8 chapters, Sharira Sthana is having 8 chapters, and Indriya Sthana 12 chapters. So these 66 chapters are called Purvarga. Chikitsa Sthana is having 30 chapters, Kalpasthana having 12 chapters, Siddhi Sthana is having 12 chapters. So these 44 chapters are called Uttarardha of Charaka Samhita, Uttarakhanda or second part. Actually, the late Dr. Bhagwan Das, who has written English commentary on Charaka Samhita, when I was a PG student, he has announced that he has got Uttara Bhaga of Charaka Samhita, Uttara Tantra of Charaka Samhita available with him. It is from Nepal Hastaprati he has collected, he said. He said he will publish, but unfortunately that is incomplete till today. The chapters names of Sutra Sthana, if you think, Dirgan Jiviti Adhyaya is the first chapter. See, the first question of human life is Dirgan Jivitiyam. What is Dirgan Jivitiyam is, I want to live for a longer time and I want to live with all prosperity, health, wealth and all amenities. And that is called Dirgan Jivitiyam Adhyaya. Second chapter is Apamarga Tanduli Adhyayam. See, immediately in the first chapter's end also lot of Yavagu Kalpanas have been explained. Medicaments have been, diet supplementaries have been explained in first chapter. If anybody follows those Yavagu Kalpanas Guruyans, definitely we will have an involvement in treating some of the pandemic diseases like viral infections. Aragvadi Adhyayam, again the medicines. Shadvirechana Ashriti Adhyayam, Matra Shriti Adhyayam, Tasyashritiyam Adhyayam, Navaigandharani Adhyayam, Indriyopakramaniyam, Kuddaka Chatushpadiyam Adhyayam, Maha Chatushpadam Adhyayam, Tisreshani Adhyayam, Vatakala Kaliya Adhyayam. 12th chapter of Sutra Sthana is one of the important most chapter for all the Samhita readers of Charaka Samhita because it explains about Vata. Vata dosha is called Prabhu, and that's why this chapter is explained in 12th chapter. Snehadhyayam, Svedadhyayam, Upakalpani Adhyayam are explained later. And Chikitsa Prabhrutiyam, Kiyantashrasi Adhyayam, Trishothi Adhyayam, Ashtodariyam, Maharoga Adhyayam, Ashto Ninditi Adhyayam, Langana Brahmani Adhyayam, Santarpani Adhyayam, Vidishoniti Adhyayam. So even though Acharya Sushruta is expert in Rakta Pradhana doshas understanding, Acharya Charaka rightly explains Vidishoniti Adhyayam, where importance of Rakta and Shonitashraja Vikaras and Madamurcha Sannyasa like Sangnava Sroto Vikaras are explained. Then Ejjapurushi Adhyayam, Atreya Bhadrakapi Adhyayam, Annapana Vidhi Adhyayam, Vivida Ashita Pitiyam Adhyayam, Dasha Pranayataniyam Adhyayam, and Arte Dashamahamulya Adhyayam, 30th chapter. Arte Dashamahamulyam is an important chapter in Sutra Sthana because, see, in Chikitsa Sthana, 30th chapter is also important, and in Sutra Sthana, 30th chapter is again important. Artha means Hridaya, and there are 10 Mahamula Siras are coming out of this Hridaya, and that's why this chapter is called Arthe Dashamahamulyam Adhyayam Adhyayam. In Nidana Sthana, Jwara Nidana is explained, Raktapitta Nidana is explained, Gulma Nidana is explained, Prameha Nidana is explained, Kushta Nidana, Shosha Nidana, Unmada and Apasmara Nidana. 8 chapters are explained. These 8 chapters have got important Nidana based explanation. And by understanding these 8 examples of Nidana, we are able to understand other Nidanas of other Vyadhi Nidanas are also. In Vimanasthana, Rasavimaniyam explained. Based on Rasavimaniyam, if a person understands, see, Vimanasthana is for Viseshena Manam. The measurement is explained here. Many of the measurable things, measurables, measurements, and the techniques of measurements are explained in Vimanasthana. Trivida Kukshiya Adhyayam, one of the important aspects for gastroenterology, and Janapadodvamsaniyam Adhyayam. In Janapadodvamsaniyam Adhyayam, see the beauty of thinking of Acharya Charaka. Janapadodvamsaniya is one of the epidemic and pandemic disease explained, but he is explaining in Vimanasthana. Lot of measurables are explained in Janapadodvamsaniya Adhyayam. If you can read this third chapter, he says, what are the measurables in Vimanasthana perspective in pandemic diseases? He says four important factors: Desha, Kala, Vayu, Jala. Four measurable sectors have been explained. And also he says, is with respect to our principal, we are doing a surveys in our hospital of distribution of rasayana vatis for this prevention of pandemic disease. I am seeing many people who are afraid of this disease. They are panic about this disease. They are having rajoguna pradhana and tamoguna pradhana worries in them. They are making huge crowd in the hospital to collect this rasayana. So their sattva bala is decreased. When a person is afraid of anything, due to the fear, anxiety, or depression, the person's immune system collapses. Reticuloendothelial system functioning collapses. The white bone marrow or red bone marrow's activities inside the asthi dhatu also declines. Due to that fear and anxiety, T lymphocytes, which are released by the thymus gland, and B lymphocytes, which are released by the bone marrow, will not be performing their actual innate immunity functions. So, anxiety, fear, bhaya, shoka, and all these manasa vikaras are responsible for immunosuppression, and hence the pandemic viral disease increases. One who is strong, one who is having sattva bala, one who is following Charaka Samhita, if he is having all the perspective of Janapadodvamsa's preventive aspects, then definitely a person will not suffer with any of the unnecessarily viral infections. The innate immunity develops. See, there is a beauty of understanding Janapadodvamsani Adhyaya, and hence Acharya Charaka has explained. त्रिविध रोग विशेष विज्ञानीयम स्रोतो विमानीयम रोगानीकम विमानीयम व्याधित रूपीय विमानीयम रोगाविषज्जितीय रोग विषज्जातीय अध्याय. And in Sharira Sthana, Katida Purusham Shariram, Atulya Gotriyam Shariram. See, in Katida Purusham, lot of Daiva, Purushakara, and Chetana, Atma, all these philosophical aspects of Charaka Samhitas are explained. No other Samhita has given one separate chapter for these philosophical concepts of medicine. That's why I remember Professor C.P. Shukla sir was telling Charaka Samhita is not simple medical text. It is not a disease and treatment aspects documentation. It is philosophy of medicine. If you come to Sushruta, he is more practical oriented person. And if you come to Vagbhata is final concluded outcome of the research, just mantravat samprayuktavyam namimamsa kadachana. Acharya Vagbhata writes in its last chapter of Uttara Tantra that whatever I have written, you just understand and use it in your practice and you will get the results. Don't do any doubt on the things what I have told. If you see in Ashtanga Hridaya, philosophical perspectives of Acharya Charaka are minimized. It is only just like sims and mims what you get in the modern medicine. Just like that, Ashtanga Hridaya is prepared. You understand the disease and treat the disease as per the guidelines. Atulya Gotriyam Adhyayam is one of the beautiful genetic concepts explained by Acharya Charaka. The Homo sapiens are having a continuation of their species and their genes, and it is explained in this. Khuddaka Garbhava Kranti Shariram, Mahati Garbhava Kranti Shariram. These two chapters will explain most important concepts of embryology and developmental medicine. Purusha Vichayam, Sharira Vichayam, Sankhya Shariram, Jati Sutriyam. In the 8th chapter of Jati Sutriyam, so many informations about the medical practices have been explained, and even he explains the male and female copulation methods, and reproductive medicine techniques are also explained. And in Indriya Sthana, he starts explaining a lot of Indriya Vishayas, Indriya Miti Go. Go means observations done by a cow in all directions. Varnaswariyam Indriyam Adhyayam, Pushpita Kamiyam Indriyam Adhyayam, Parimarshaniyam Indriyam Adhyayam, third chapter, Indriyanekam, Purvarupiyam, Katamana Shaririyam, Pannarupiyam, Avakshiriyam, Yashwavamaniyam, Sadhyomaraniyam Adhyayam. This is one of the important chapter where a clinical practitioner should be more important to these chapters, where he says these are the symptoms of person who is going to die in 24 hours, 48 hours, or 3 days, like that. Then Anujyotiyam, Bhumaya Churniyam Adhyam also explains lot of clinical explanations for observations directly done by Vaidya. Now, Acharya Charaka has planned Charaka Samhita, Sutra Sthana with Chatushkas. Some 4 groups have been made. Categories of 4 chapters is called Chatushka. Etymology of the word Chatushka, Chatvaro Abhaiva Yasava Kan. The one which is comprised of 4 parts or 4 factors is called Chatushka. Meaning of the word Chatushka is, it is a collection of 4 different subjects led by one group. A hall resting in 4 pillars, a necklace of 4 strings, a set of 4, or a quadrangular presentation. See, Roga Chatushka is, you can give an example. Kiyanta Shirasiyam, Trishotiyam, Ashtodariyam, and Maharogadhyayam. These 4 chapters are together called Roga Chatushka Adhyayas. The word Chatushka is also to denote group of 4 in various places. Itu Chatushkaha Kashaya Vargaha, Vakshante tu Chatushkena, Chatushkascha Dasha. Like this, these Chatushka word is used to denote 4 different chapters dispersed in this text. Where this Chatushka methodology has been originated from. Historically, we should understand, as everybody believed that, even if you see Acharya Charaka's Chikitsa Sthana, the first 2 chapters are having Chatushkas. Rasayana Adhyaya has got 4 padas, and Vajikarana Adhyaya is also having 4 padas. From 3rd chapter, Kaya Chikitsa starts with Jara. And one important Samhita's priority-wise presentation you should understand. In Charaka Samhita, Rasayana and Vajikarana chapters are kept in Chikitsa Sthana first chapters. First 2 chapters are Rasayana and Vajikarana in Charaka Samhita. Whereas in Sushruta Samhita, it has gone to Chikitsa Sthana middle, 24, 25, 26 chapter it has been explained. Whereas if you see in Ashtanga Hridaya and Ashtanga Sangraha, it is in Uttara Tantra last chapters. It is in Uttara Tantra last chapters. So, everybody believes that the original primary source of all, present knowledge is hidden in Vedic literature, and Chatushka is no exclusion for this. The division of 4 is seen in Vedika Kala also. In Chandogya Upanishad, Brahma is called Chatushpada. Tadai Chatushpadat Brahma, Vakpadaha, Pranapadaha, Chakshupadaha, Shotrapadaha, Iti Adhyatma. If you see, the Brahma is having Chatushpadas. In Mandukya Upanishad, Vaishwanara, Taijasa, Pragna, and Turiya, 4 padas of Brahma or 4 stages of life is explained. In Chandogya Upanishad, Gayatri is divided into 4 pada. Saisha, Chatushpada, Gayatri. And if you see again in Vedanta Sahitya, which is very important for the Samhita Pradhana studies of Ayurveda, the Brahma Sutras written by Vedavyasa is also having 4 chapters. 4 padas and subdivided with many padas. So this Chatushka concept was prevalent in Vedic period, in Upanishad period, and even in Brahma Sutra periods. The same Upanishad concept, and Ayurveda is a Panchama Veda, or Ayurveda is Upaveda of Rigveda. Hence, this Chatushka concept has also been taken out by Acharya Charaka, and we don't see this Chatushka concept in further textbooks. In Manusmriti and in Charaka Samhita, Dharma is told to be having 4 padas. Even in Janapada Dhamsini Adhyaya, Acharya Charaka says, Yuge Yuge Dharma Padaha. In every yuga, one pada of the dharma is declining. In Patanjali Yoga Shastra, the main text of Yoga Darshana, the number of sutras are 195 and are divided in 4 pada. Samadhi pada of 51 sutras, Sadhana pada of 55 sutras, Vibhuti pada 55 sutras, and Kaivalya pada 34 sutras. In Panini Kruta Ashtadhyayi, the well-known text of Sanskrit grammar written by Panini is composed of 8 adhyayas, each containing of 4 padas. The Vedas are 4 in number: Rigveda, Yajurveda, Atharvaveda, Samaveda. Each Veda consists of 4 parts, 4 padas. Samhita, Vidhi, Aranyaka, and Upanishad. These are 4 parvas from one shaka. So if you want to study the Vedas, you should know the Samhita Bhaga, Vidhi Bhaga, Aranyaka Bhaga, and Upanishad Bhaga. Ayurveda shows its gratitude towards the Atharva Veda, Chaturnam, Asrukayam, Yajurveda, Vedanam, Atmano, Atharva Vede, Bhakti Radesha. Sri Charaka Sutra Sthana 30th chapter says, one can say that Chatushka methodology may be adopted from Vedic literature itself. So when and whose contribution is this Chatushka methodology? There are many archaeological layers in building the Samhita. Regarding Charaka Samhita, the 3 distinct layers are visible. Tantra Pranayana by Agnivesha Krita Tantra, Pratisamskarta Charaka, and Sampurna Vibhaga by Dridapala. Now the question arises that among them, whose contribution are these Chatushkas? Dridapala gets excluded because among the 41 chapters which he has completed, no chapter is having Sutra Sthana. It is very difficult to say that whether this method is assimilated in Samhita, in Tantra Kala, or Samhita Kala. Hence, it may be stated that the contribution of Charaka is because of the division of 4 is as old as Vedas. Why this method is adopted only in Sutra Sthana? The Chatushka method is adopted in Sutra Sthana. It acts as the Uddesha of Samhita. Chatushkas are Uddesha explaining in Samhita. It is the collection of sutras which are to be applied to all over the Samhita. Each sthana explains some of its parts, so it is not possible and also not necessary to divide each sthana in this manner. How this arrangement is made in Charaka? In Chatushkas are arranged. The arrangement of Chatushkas is the 30 chapters of Sutra Sthana are arranged in 7 Chatushkas and 2 Sangrahadhyas. Oshada Swasta Nirdesha Kalpana Roga Yojana Chatushka Shat Kramenoka Saptascha Sannipat Saptascha Annapanikaha. 7 Chatushkas and 2 Sangrahadhyas are explained. In Veshaja Chatushka, it acquires first position among the all Chatushkas. The chapters deals with drugs and medicine. The chapters of Chatushkas are Dirganjivitiyam, Apamarga Tanduliyam, Aragvadiyam, Shadvirechana Shatiyam. See, the beauty of Dirganjivitiyam is the first chapter in the first Bheshaja Chatushka. And the first chapter is a Bheshaja Chatushka. So if you want to get out of this quarantine life, lockdown life, or pandemic life, you follow the first 4 chapters. You will get the clue and answers for pandemic illnesses, and you want to live long in this quarantine life, healthy life, long life, without viral infection life, then read these 4 chapters of Bheshaja Chatushka. In Dirgandhivitiya starts with Ayurveda Avatarana, Trisutra Ayurveda, and Shadvida Padarthas, Roga Karanas, Dosha Varnanas, and Dravya Sangrahas, and Dravya Vargikaranas. In Dravya Sangraha and Dravya Vargikarana, what dietary supplements have been told they are effective in management of pandemic life. In Apamarga Tanduliya, Shiro Virechaniya Dravyas are explained, Vamana Dravyas, Virechanagana Dravyas, Astapana Basti Dravyas, Anuvasana Basti Dravyas, and 28 type of Yavagus are explained in Apamarga Tanduliya. These 28 type of Yavagus are highly clinical practice instruments. These are the Karanas. And don't search for such quantum of dietary supplements in Chikitsa Sthana. In second chapter of Sutra Sthana, the Bheshaj Chatushka explains about 28 Yavagus. All are clinically to be taken for clinical trials and which is effective for which pandemic group. Whether ICU group requires which Yavagu, the asymptomatic mass public requires which Yavagu Kalpanas, the primary contacts requires which Yavagu Kalpanas, and the symptomatic positive people, mild to moderate degree patient requires which Yavagu Kalpanas, and severe ICU patient requires which Yavagu Kalpanas. People don't know in the world that during symptomatic phase, what should be the diet of a pandemic patient. People don't know that when you have a mild to moderate symptoms, what is the medicine everybody are talking about, but nobody is not bothered about what should be our diet, what should be our daily food supplements. This is explained in Acharya Charaka Samhita, Apamarga Tanduliya Adhyayam. In Aragvadiya Adhyayam, 32 types of churnas and pradehas are explained. See, one of the rare presentation of COVID-19 virus is it also leads to pitta kapha or kapha pitta pradhana kushta lakshanas. So, the Aragvadiya Adhyaya explains some of the pradehas. We can choose Aragvadiya Adhyaya told some of the recipes to be applied for external usage of COVID-19 induced skin diseases. In Shadvirechana Shatiya Adhyayam, 600 Virechana yogas are explained. So many quantum is useful in Virechana, and the guideline makers and guideline users should be carefully reading these Virechana yogas, because this is the Bheshaj Chatushka of Acharya Charaka. If you want to reduce the viral load in the body, whether it is asymptomatic person or symptomatic person, mild to moderate person, except severely in the end stage COVID person, these Virechana yogas from Shadvirechana Shati Adhyaya should be selected to make mild to moderate Shodhanam so that viral load declines. The Vamana yogas are explained in 355 Vamana yogas, 245 Virechana yogas, and Virechana yoga ashrayas are 6, and 5 Kashaya yonis are explained, 5 Kashaya kalpanas are explained, 500 Kashaya kalpanas in 50 Mahakashaya ganas are explained. These 50 Mahakashayas are actually the handbook for the practitioners of Ayurveda. Actually, the teaching methodology should give more focus. So I don't know, the delegates who are participating today may be tomorrow's policy makers. If you become a policy maker, please give more stress for this 50 Mahakashayas of Acharya Charaka Samhita, 4th chapter, or 28 Yavagus of Apamarga Tanduliya, so that they are the ready reckoners for the practitioners of India and abroad. In Swasta Chatushka, it is placed as second in the position, and major portion of the Chatushka describes the various procedures essential for maintenance of health. So these are all the lifestyle guidelines. Dinacharya and Rutucharya are explained in these Chatushkas. The chapters like Matra Shitiya contains Ahara Matra, Nindita Aharas, and Sada Sevaniya Aharas. See, no medical textbook in the world talks about Nindita Aharas and Sada Sevaniya Aharas. This sort of classification is not available in the modern medical books. Swasta Vrutta Acharana is explained in this chapter. In Tasyashitiya Adhyayam, Shed Rutus are explained. Ahara Vihara to be followed in each Rutu is explained. Now we are in Varsha Rutu, COVID-19 cases we have to handle. In the previous month, we were having Grishma Rutu and we had to handle the COVID-19 pandemic cases. See the difference. In Grishma Ritu, the spread and the severity and virulence of the virus was different, and in Varsha Ritu, it need not be same. Due to the climatic changes, the management strategy should be changed. The policymakers, again, the parliamentarians and policymakers should be given a chance to read all these things and understand and make a plan accordingly. See, Grishma Ritu's pandemic management will be different in Varsha Ritu's pandemic management. I'm giving an example of pandemic example because it is a current burning issue. Similarly, the management of Madhumeha Rogi in Varsha Ritu is different when compared to Grishma Ritu. The biological circle and biological rhythm of the body changes according to the Ritu and Ritu Sandhikala. And Satmya and Voka Satmya are explained in this chapter. If you read Navega and Dharaniya Adhyayam, Adharaniya Vegas are told 13 and 3 Dharaniya Vegas are told. Very interesting chapter of Ayurveda is this Navega and Dharaniya Adhyayam because no such comparative some chapter can be seen in our counterpart modern medical education system or textbook system. There is no such thinking at all. Only the person to think about these sort of Vegas, Dharani and Adharani Vegas is only Acharya Charaka and followed by Vagvata and Sushruta. So we should not do Dharana of 13 Adharani Vegas and we should not do Udirana of 13 Adharani Vegas. Similarly, Dharaniya 3 Vegas, Udirana should not be done and Dharaniya Vegas must be done Dharana. If any mistake is done in these 4 perspectives, the person's immunological bioclock disturbs. And due to that, disease manifestation, pathophysiological sequences starts. So whenever a clinical training is given, Samhita based clinical perspective is in this chapter. Actually, the teaching in clinical posting should be based on this Navega and Dharani Adhyaya because we don't understand a direct cause for all disease. Of course, except in infective diseases, we can understand a direct cause. But cause and effect theory will not sustain in modern science, but Ayurvedically we can prove Karya Karana Siddhanta for many of the clinical conditions and examination purpose. So there is a direct relationship between Samprapti and Lakshana. So Samprapti Lakshanayoho Sambandha is one textbook written by the author to tell you about the presentations of a disease based on these etiological systems. And Vyayama is explained in this chapter, and Hita and Ahita Ahara Sevana again is told. See, Nindita Ahara and Sevaniya Ahara is told in Matrashiti Adhyaya, and in Navegan Dharani Adhyaya, Hita Aharam, Ahita Aharam is told. These are all very logical chapters to be understood by the student or a research scholar or a postgraduate student. There is a hairline difference between Hita Ahara and Ahita Ahara, Nindita Ahara and Sada Sevani Ahara. These 4 chapters, 4 perspectives of our diet system should be developed. And based on this perspective of Sutra Sthanas, Bheshja Chatushka and Swasta Chatushka, a dietology or dietology courses can be started in Ayurveda. A short-term courses can be developed as it is in naturopathy and other systems. In Indriyopakramani Adhyaya, Pancha Panchakas are explained, Manas and its gunas are explained, Pancha Gnanendriyas are explained, again Sadvruta Acharana is explained. Indriyopakramani Adhyaya is one of the important psychology and psychiatry based explanations are told. Indriyas and superpowers present in Indriyas are explained. It is very important for clinical section. In Kalpana Chatushka, the major portion of Chatushka is Snehadhyaya, Svedadhyaya, Upakalpani Adhyaya, Chikitsa Prakriti Adhyaya. So, in Snehadhyaya, Sneha Yoni, Chaturvida Sneha, Sneha Pravicharana, Sneha Matra, Yogya and Ayogya for Sneha, and Snehana Kala is explained. See, in Sutra Sthana itself, the entire Panchakarma Upayogi Snehadhyaya is explained. In Svedadhyaya, Svedana Labha, Svedana Bhedas, Yogya and Ayogya for Svedana, Sagni Svedanas of 13 types, and Niragni Svedanas are explained. All clinical perspective of Panchakarma, Purva Karmas are explained in this chapter. In Upakalpani Adhyaya, Vamana Virechana Upayukta Samagris are explained. The preparations in practicing Panchakarma is explained. Vamana and Virechana Vidhis, the actual procedures are explained. Matra Nirdharana is also explained. Ayogya Lakshana, Samyak Yoga Lakshana, and Upadravas of these Shodhana Upakramas are also explained. In Chikitsa Pravritiya, Samyak Virikta Lakshanas, Vamana Virechana Atyoga Lakshanas, Samshodhana Labha, the total outcome of Samshodhana Chikitsa is explained. Snehana, Svedana, Vamana, Virechana, Basti, and Nasya in short, and Swabhavo Paramavada is explained. Swabhavo Paramavada is described as one of the citations done by Acharya Charaka. Says this is some Swabhavo Paramavada is told like this. And Swabhava Paramavada says the Vyadhi comes on its Swabhava and the Vyadhi will decline on its Swabhava. So there is no question of doing anything from Vaidya. So hence there is a question in the commentary in the opinion that whether Swabhava Paramavada was accepted theory of Acharya Charaka or it was only a passing reference that it is told like this. Swabhava Paramavada belongs to Buddhism and Jainism school of thought according to someone. And the viral infection has come and naturally it will decline. This is the Swabhava Paramavada's theory. Of course, the intervention of the Vaidya is required to help that Swabhavataha Vyadhi will come down, but the time taken and the damage done will be minimized by the intervention of Vaidya. Roga Chatushkas. Roga Chatushkas are very important aspects for disease understanding. Kiyanta Sharasiyam, Trishothiyam, Ashtodariyam, Maharogadhyayam. In Kiyanta Sharasi Adhyaya, Shiroroga Nidana and Samprapti is told, Rudroga is explained, 18 types of Kshaya Lakshanas are explained, Vidradi Lakshanas are explained, Prameha Pidika Lakshanas are explained, Trivida Gati of Dosha is explained. And I love this chapter always in my teachings. Kiyanta Shirasiya is one of my favorite chapter in Charaka Samhita Sutra Stana. So many concepts have been explained. Actually, it will be a separate 1 hour discussion on one chapter, Kiyanta Shrisiyam. Even in 1 hour, this cannot be explained. But I am stressing that every student must read again and again Kiyanta Shrisi Adhyaya of Charaka Sutra Sthana, because various clinical aspects, various diagnostic features, various clinical diseases have been explained, which are not explained in Chikitsa Sthana. Hence, the Vidradi, which is a Dhanvantariya Adhikara, is also explained in this chapter. Hridroga and Krimija Hridroga, subacute bacterial endocarditis. Professor C.P. Shukla sir was giving more living example of this subacute bacterial endocarditis based on this Kiyanta Shilsi Adhyaya's Hridroga explanation. So, hence, Swargiya, Dr. Yemishwar Reddy sir was telling about this. The Krimija Hridroga is explained in this Kiyanta Shrisi Adhyayam. Based on that, he started practicing the Krimihara Basti and Krimihara Taila Anuvasana Basti. These two drugs were prepared by most respected Dr. Nagireddy of Bellary. So, like this, these clinical development starts from Sutrasthana Roga Chatushka Adhyayas. In Trishoti Adhyaya, Nijaguntaja Shotas are explained. See, in the Robbins textbook of pathology, Shota is the first chapter. Cell injury and inflammation is the first beginning chapters of pathology of modern science. So in Roga Chatushka, Acharya Charaka is explaining Nija and Agantaja Shotas. Vataja Pittaja Kafaja Shota Lakshanas are explained. Ekadeshiya Shotas are explained. Prakrita Vataja Pitta Kafa karyas are also explained. In Ashtodhari Adhyaya, 48 rogas and their types are explained. Ashta Udara rogas, Ashta Mutra rogas, like that, the classification is explained. Nijagantaja doshas are again classified here. In Maharoga Adhyaya, Chaturvida rogas are explained. Roga Karanas are explained and Roga Adhishtanas are also explained. Dve Roga Karanas and Dve Roga Adhishtanas are explained. Nijagantaja Roga Karanas are again explained in Maharoga Adhyaya. Nanatmaja vikaras of Vataja Nanatmaja vikara, Pittaja Nanatmaja vikara, Kafaja Nanatmaja vikaras are explained in this Maharoga. See 80, 40, 20. Total 140 Vataja, Pittaja, Kafaja Nanatmaja vikaras are there. One simple one line out of this context, that Gugula Tiktakam Gritam was one of the favorite prescription of Dr. M. Ishwar Reddy. And even in Kerala practice also, Gugula Tiktakam Gritam is very much practiced. If you read the Falashruti of Gugula Tiktakam Gritam is indicated in Vataja, Pittaja, Kafaja, all Nanatmaja Vikaras. 80, 40, 20, all 140 Nanatmaja Vikaras are indicated in Gugula Tiktakam Gritam. One important caution is Gugula Tiktakam Gritam contains Arushkaram. Arushkaram is Bhallatakam. And Bhallatakam containing drugs should be carefully practiced. Usually we give for Arohana Snehapana or even Mahasneha users, we use this. So in Pittaja Vikaras, carefully it should be administered. In Yojana Chatushka, it is in 6th position. Ashto Ninditiyam, Langana Brahmaniyam, Santarpaniyam and Vidishonitiyam. These 4 chapters are explained in Sutra Sthana. Ashtaninditas, it is the entire endocrinology is explained by Acharya Charaka for the first time, documented in Ashtavaninditi Adhyaya. Nidra and its types are explained in Ashtavaninditi Adhyaya. Nidra Nasha and Atinidra Lakshana. Nidra Yattam Balam Pumsam. So, a great impact has been seen in Acharya Charaka's this chapter, that the sleep is one of the Trayo Upastambhas. So Ahara was also given importance in previous chapters I was telling. In Ashtav Ninditi Adhyayam, Nidra is given importance. In Langana Brahmani Adhyayam, Shadvida Chikitsa is explained. Kaya Chikitsa is explained in Shadvida Chikitsa. And Langana Brahmana, Rukshana Snehana, Svedana and Stambhana, all 6 Chikitsas are explained. And the Kaya Chikitsa's fundamentals are explained in this Langana Brahmaniyam Adhyayam. In Santarpaniyam Adhyayam, Santarpana Janya Rogas and their Chikitsa is explained, Apatarpana Janya Rogas and their explanation is done. So Kaya Chikitsa and Panchakarma have directions in this chapter. Diagnose the disease as Santarpana Janya Vikara and their treatment. Diagnose the disease as Apatarpana Janya Vikara and its treatment. So we should understand when making the guidelines for pandemic disease like viral infection, whether it is a Santarpana Janya Roga or whether it is a Apatarpana Janya Roga. This must be understood. If we can understand this discrimination, Ayurvedic concept of drug designing and drug development starts, and single drug for 130 million people is not correct. Purusham Viksha. The presentations, pathophysiology of the COVID-19 should be seen, and then the Santarpani Adhyaya told guidelines should be followed. That's why all viral infection patients are not same. Some of them are getting COVID pneumonia. Some of them are getting cytokine storm induced lakshanas. Some of them are getting small capillary thromboembolism and death. Like this, some of them are getting the diarrhea, atisara lakshana. Some of them are getting angamarda and shirashula lakshana. Some of them are getting jara. Some of them are getting kushta lakshanas. So, whenever a new disease which is not explained in Charaka Samhita comes, the name of that disease is not written, but the guidelines for understanding new viral infection or any disease for that matter. In the past, HIV was also discussed. Now, COVID-19 virus we are discussing. Tomorrow, bubonic virus we may be discussing. G4 virus we may be discussing. So, like this, every time new virus comes and new chapter should not be there or addition in the Charaka Samhita. But Charaka Samhita's guidelines are enough. to understand new viral diseases. Rakta and Rakta Vimarsha is explained in Vividha Shoniti Adhyayam, and Rakta Dushti Lakshana, Rakta Roga Chikitsa is explained, and Shuddha Rakta Lakshana, Mada, Murcha, Sannyas are explained. Actually, in Rakta Roga Chikitsa, Rakta Pitta Hara Kriya is told. Professor Dr. M.S. Bagel, in my PG studies, sir was telling that the cerebrovascular accidents are to be understood based on this Vidishoniti Adhyaya. He was telling the cerebrovascular hemorrhages or cerebrovascular thromboembolism and ischemia are presentation of Rakta Dushtir and Rakta Roga Lakshanas. Vidishoniti Adhyaya should be sought. It is a ऊर्ध्वगत रक्तपित्त लक्षण सो चिकित्सा इज प्रतिमार्गम च हरणम रक्तपित्ते विधीयते so in pakshagate virechana is based on this concept, and pakshagata cases when Glasgow's coma scale is more than less than 13, then patient is in serious condition, whether it is due to agantuja trauma or nija trauma, tridosha sannipataja trauma. Then the patient comes with unconsciousness, semi-consciousness, or altered consciousness. Then Madamurcha Sannyasa is a Raktaja Vikara. So this cerebrovascular disease should be understood. Pakshagata Samprapti should be understood based on this Vidishonitiyam Adhyaya. Annapana Chatushkam, it contains Ajjapurushiyam, Atreya Badrakapiyam, Annapana Vidhi Adhyayam, and Vividha Ashita Piti Adhyayam. In Yajjapurushi Adhyaya, Hita Ahara is explained, Ahara Vargikarana is done, Patya Ahara Lakshanas are told, 84 Asava Yonis are explained in this Yajjapurushi Adhyaya. One of the broad perspective of research in dietetics and Asava Kalpana can be taken from this chapter. In Atreya Badrakapi Adhyayam, Rasa Sankhya Nirdarshana, a huge debate and conference or discussion takes place, deliberation takes place. Anurasa, Dravya, Guna, Shadrasa, Panchabhutika Sangatana of Rasa, Vipaka, Virya, Prabhava, and Viruddhahara is explained in this Atreya Badrakapi Adhyayam. If you read this Atreya Badrakapi Adhyayam, in the Viruddhahara context, Klaibya word is told. The Shandatva or Klaibya, it is not happening by any of the external factors, but it is because of not understanding the explanations of Viruddhahara. If a person consumes Viruddhahara for sustained period of time, he will suffer with the Klaibya. So sexual dysfunctions have got a root in our wrong diet style or Viruddhahara concept. Annapana Vidhi Adhyayam contains classification of Ahara Dravya and Anupana. And in Vidishoniti Adhyaya, Chaturvida Ahara, Ashita Pita, Lila, Khadita, 4 types of food are explained. Ahara Paka Prakriya. See, in Sutra Sthana, again and again emphasis has been given on food, food processing, food preparations, and food qualities, and food categorization. Diseases are due to the incompatible food. Again in Vidishoniti Adhyaya, most of the diseases are due to the incompatible food. So we should again and again think the food industry in India has taken a lot of westernized concept. All are having some or other defects in westernized food style. So westernized food style are having lot of examples for incompatible foods with the haras, and that's why India is getting lot of diseases. In Sangraha Adhyayas, Dasha Pranayataniya Adhyaya and Arte Dasha Mahamulya Adhyaya. These two Adhyayas are called Sangraha Dvaya, and these Adhyayas are the index of Sutra Sthana and the whole text respectively. In Dasha Pranayatanas are explained. See, whenever we are studying a new disease which is not explained in Charaka Samhita like COVID-19 or SARS-CoV-2 virus, we should understand what is the impact of this Agantuja virus, a Upasargika Roga, on Dasha Pranayatanas. Whenever a clinical research student is working on a disease, they should make out some correlation between Dasha Pranayatana and the manifestation of that particular disease. We should also understand a case sheet should be prepared in Kaya Chikitsa and Panchakarma or in any clinical subject based on Dasha Pranayatanas and their assessment. Otherwise, the clinical trial is simply a copycat of modern protocol. Pranabhisara Vaidya Lakshanas and Rogabhisara Vaidya Lakshanas are told. See, first few days of COVID-19, the people started telling it is a droplet infection and it will cause fever, cough, cold. Whereas later on they said there is a cytokine storm and person is dying due to the pneumonia, COVID pneumonia. And later on now they are telling it is due to the infarction in the capillaries of the lung and patient is dying due to those multiple capillary infarctions. Vatarakta samprapti. Pneumonia samprapti is Jara samprapti. And Pinasakasa is Raja Yakshma samprapti. So whether we are Pranabhisara Vaidyas or Rogabhisara Vaidyas, and sometimes they said one drug is good for prevention and it causes heart attack. Another time they said these anti-HIV drugs are effective. What are the long-term studies, long-term effects? So, by doing repeated, what you call a uncontrolled, unbased, biased thinking, whether we are going towards Rogabhisara Vaidya Lakshanas instead of Pranabhisara Vaidya. So we should bring back the dying person to back to his life, not making death for him. In Arte Dasha Mahamulidhyaya, important aspects of Hridaya and Ojas, important explanations about Ojas is explained, and Dhamani, Srotas, and Siras are explained. Ayurveda with Vaidya Lakshanas, Hita and Ahita Ayu Lakshanas, Sukha and Asukha Ayu Lakshanas, Ayurveda Prayojana, all these have been explained. We can do some highlights of Dirganjiviti Adhyayam. The first chapter, Dirganjiviti Adhyaya, explains important concepts such as Vatapitta Kapha Siddhanta, Tridosha Siddhanta, Rasa Siddhanta, in short, Shed Padartha Siddhanta, which are integral to Ayurveda and used extensively throughout the Charaka Samhita. What I want to say is, if a new person want to understand Ayurveda means, they must understand Tridosha Siddhanta, Rasa and Shatpadartha Siddhanta in the beginning. If you are giving a course for foreigners, or now there are some thinking that MBBS students should understand some of the basic principles of Ayurveda. For that, this first chapter, these concepts are must be introduced. Besides these technical terms, first chapter also describes various medicines like Falini Dravyas, therapeutically useful fruits as drugs, and Mulini Dravyas, therapeutically useful roots as drugs, Mahasnehas, four kinds of fats like Gruta, Taila, Vasa, Majja, Lavana Vargas, and various types of Mutra Vargas, Kshira Vargas, these are explained. So, a beginner of Ayurveda should learn these substances as one of the useful material for medical management. The chapter emphasizes also on the rational usage of medications, since the indiscriminate use of even good medicines can cause more harm than good. The chapter then goes on to explain important concepts of Trisutra, the Hetulinga Aushadha Gnanam Swastatura Parayana. So, whenever you are preparing a case sheet, the clinical persons of any branch of Ayurveda should develop Hetulinga Aushadha based case sheets. One is Hetuskanda. Try to collect and examine all Hetus in the patient, and Lingaskanda. What are the signs and symptoms present in the patients? Whether it is a surgical signs and symptoms, pediatric signs and symptoms, Prasuti signs and symptoms. You collect all the signs and symptoms in this heading, and Aushadha Siddhanta. Aushadha is also medicine, but Aushadha is explained in Vagbata also, parallel to this Acharya Charaka's concept. Acharya Charaka says Trividam Aushadam. Acharya Vagbata says Trividam Aushadam. Shodhanam Shamanam Cheti Samasad Aushadam Dvida. This is Vagbata's concept. Shodhana and Shamana are two types of Aushadha. Shodhana is also Aushadha. Shamana is also Aushadha. So you should understand that Shodhana Aushadha and Shamana Aushadha both come under this three sutra area. Hetulinga Aushadha Gnanam Sustatura Parayana. In Apamarga Tanduli Adhyaya, it deals with specifically the herbs and medicines to be used during or after Panchakarma. 5 methods of bio cleansing or bio purification methods are there. So Panchakarma Upayogi chapter is this. Thus, the first 2 chapters of the tetrad describe various medicines to be used for internal. See the beauty of Charaka Samhita's configuration. The first chapter itself is on medicine usage. Actually, see the medical textbook in the modern medicine, they start all basics first and then they tell about usage of medicine. But Acharya Charaka says the student of Ayurveda should start understanding Aushadha and medicine in the first chapter itself and second chapter itself. Are we doing this in our curriculum of 5.5 years course? We are not doing this. In the first 1.5 years, we are giving non-clinical. Then in 1.5 years, we are giving pre-clinical, and in the last 1.5 years, we are giving clinical. Actually, 5.5 course of Ayurveda degree should be from the day one. The student should be exposed to the medicines of Ayurveda, understanding of health concepts of Ayurveda, understanding of Rogi and Roga, because Acharya Charaka starts with diseases and medicines in the first chapter and second chapter itself. So, Ayurveda Samhita based curriculum designing is also one of the challenging part for Government of India. Many works are going on. Let us dream that Acharya Charaka based curriculum development may start. Of course, I accept that anatomy, physiology must be taught in the beginning year. Along with that, Acharya Charaka's chapters of the beginning must be taught, where the student is exposed in the morning clinical session that at least 2 hours he is working with patients, he is looking patients, he is wandering in the wards, he is seeing what patient is eating, what is advised by the Vaidya, what is done by the senior doctors, and then he starts understanding Rogi and Roga concepts from the first year. Aragvadi Adhyayam says with it deals with the usage of external medication, topical medications or medicines to be applied externally. The Lepa Kalpas are also explained. So the beginning student should watch what is lepas are done in the hospital. Gradually he will learn what it is. The curiosity develops. What is this Aragodadi lepa? What is this lepa used in this disease? The student starts learning. Need-based medical learning is Charaka Samhita style. I want to say that my opinion is that Charaka Samhita is written in a fashion that it is need-based learning. In Gurukula system, the student who is learning Shad Darshanas was also taught with Ayurveda Darshana. Then, the beginning only they were told Lepas, they were told Yavagus, they were told Aragvada the Lepas, they were told the Shadvirechana Shatya Shriti Adhyayas Mahakashayas. There are 50 Mahakashayas. So in each one Kashaya, 10 drugs are there. 500 drugs are exposed to the beginning student of first year BMS. Then if you can imagine what happens from the first BMS, he is exposed to some drugs, some kashaya is prepared. So gradually the students will repeatedly understand, and in higher classes he will be more expertised with the administrative techniques. Overall, this Chatushka provides list of drugs to be used in various forms in varieties of diseases. Matra Shitiya Adhyaya, it is dealing with the daily regimen to be followed by healthy individual to maintain their health. The Tasyashiti Adhyaya recommends changes one should make in his or her daily habits and lifestyle, that is clothing, food habits, exercise, depending upon the season, and this is for staying healthy. So when coronavirus started 4 months back, then the people started advising the usage of masks, usage of hand sanitizers, usage of hand washing techniques, and usage of social distancing. These are all Tasyashiti Adhyaya's concept only. Navegandharani Adhyaya explains importance of suppressible and non-suppressible urges in the human body, diseases due to non-suppressible urges and their treatment is also explained. In Indriyopakramani Adhyaya, it deals with Sadvrutta, General Code of Conduct. See, what is the General Code of Conduct for COVID-19? Government of India has given a guideline for COVID-19. Similarly, Acharya Charaka has given for lifelong code of conduct. For every Indian citizen, Sadhrutta, that is the code of conduct, is told from birth till death. Besides maintaining his own health, Sadhrutta also helps the individual in maintaining healthy relations with other individuals, thus helping maintaining harmony in the society at a large. The social health and social distancing like concept must be understood from this chapter. Kuddaka Chatushpadiyam Adhyayam deals with Vaidya, Dravya, Upasthata and Rogi. See, in COVID-19 force, COVID workforce is there in government, and where what we are doing, one of the physician will be there. What are the drugs to be used in COVID-19 are there. The Upasthata, what are the duties and do's and don'ts for helping nursing staff or cleaning staffs. These are all also explained. So then the qualities of a patient is also explained. In Chatushpada Adhyaya, it explains the classification of diseases and basis of prognosis. On the basis of prognosis, it is recommended in this chapter that the treatment should only be initiated after thorough diagnosis and identification of the disease, and the physician should refrain himself from treating the incurable disease. See, Ayurveda gives limitation, and Charaka Samhita says this Samhita is written for Sadhya Vyadis. This is not for Asadhya and Pratyakshaya Vyadis. People will ask for every disease, Charaka Samhita is written a medicine. It's not like that. Ayurveda Samhita, Charaka Samhita, he says, I am telling only Kaya Chikitsa Pradhana Aushadis, and I am also telling Sadhya Vyadhi Chikitsa Sutras. And Asadhya Vyadhi Chikitsa Sutra is not written in Charaka Samhita. That's why in Nagarjuna period, Siddha Nagarjuna period of 11th century, he says, Siddhe Rase Karishame Nirdaridra Gadam Jagat. Where Kashtaushadis are unable to treat some of the Asadhya Vyadis, Asadhyeshu Pidatavyo Aushadibhyo Adhiko Rasaha. When Asadhya Vyadis comes, then beyond thinking of these chapters, Rasaushadhi starts thinking. Unfortunately, we are not thinking about the nanoparticles and nanotechnology in Ayurveda in relation to the management of pandemic diseases. Of course, the research scientists of modern science are working on nano sponges, and introduction of nano sponges will kill the virus which enters into the body. Whereas nanoparticles of Ayurveda are neglected. Of course, in future coming days, we shall also take up nanotechnology of Ayurveda, the bhasmas and related aushadhis should be used in pandemic disease. In Tisreshani Adhyaya, it deals with the three types of desires: strength, causes of the disease, diseases themselves, paths, and physicians and therapies. All these are explained in Tisreshani Adhyaya. In Vatakalakali Adhyayam, good and bad qualities and functions of Vata Pitta Kapha are told. When Vata is normal, how it will bestow the person. When Vata is abnormal, how it will make some problems to the person. A physician should have thorough knowledge of the guidelines provided in this tetrad to succeed in this field. The Snehadhyaya provides guidelines for the proper use of snehas, lipids and fats, and for Shodhana purpose or Shamana purpose, the person should understand. A patient who has successfully completed Snehapana procedure is now subjected to Svedana therapies. So in Svedadhyaya, various types of Svedanas are recommended for different diseases. Snehana and Svedana are Purva Karmas, help in toxin to move towards the gut, from where they will be expelled out of the body either through Vamana or Virechana or Basti, etc. See, Snehana Svedana will cause the internal GI tract mild therapeutically created scientific inflammatory process. After Snehapana and Svedana, there is the movement of doshas from external to the internal, that is extracellular fluid to intracellular fluid and then to the gut. Means there is a inflammation taking place in the gut mucous membrane. That inflammation attracts some of the cytokines and interleukins. They will be getting from the extracellular fluid and from cell to the gut mucous membrane. From the gut mucous membrane, Vamana Virechana Basti will be throwing out the toxins out of the body. So this is very important. Scientific study should be done on Snehana Svedana Adhyaya. In Upakalpani Adhyaya emphasizes how physicians should be well equipped before administering the Shodhana procedure to any of the patient. Except ICU COVID patients, Ayurveda, Panchakarma, Shodhana, Chikitsa and Shamana Chikitsa can be adopted. This chapter also provides outline of a fully equipped hospital and standard Vamana Virechana procedural equipments. So, in Upakalpani Adhyaya, the major two Shodhana therapies are well explained. In Chikitsa Pravritti Adhyayam, there is importance of Shodhana and Shamana therapy. See, Acharya Charaka is giving more importance and discussions on Shodhana and Shamana only. The details of properly or improperly administered Shodhana procedures are discussed here. Important concepts like Shuddha Chikitsa, pure form of treatment, and Swabhava Paramavada, natural destruction theory, have also been described in this chapter. See, Shuddha Chikitsa is very important. I will come to that later if time permits. Shuddha Chikitsa means that Chikitsa which is curing the disease but not causing any side effects, that is not causing any untoward effects, then it is called Shuddha Chikitsa. Kyanta Shirasi Adhyayam, it is one of the important most chapter in Charaka Samhita, where the diseases like Shiroroga, diseases of the head, or 18 types of Kshaya, or 18 types of loss of body tissues, Dhatu Kshaya Lakshanas are also explained. And in Vidradi chapter is covering where some of the aspects of Samprapti of Vidradi are also explained. And Madhumeha Samprapti is explained in this chapter. This is one interesting thing to know. Professor C.P. Shukla and Professor Gurdeep San sir and even Acharya Hajmani sir was giving more example of this. See, in Prameha Chikitsa Adhyaya and Prameha Nidana Adhyaya, the Prameha which is a Mutrava Sroto Vikara is explained. Of course, all Vimshati Prameha Kalantarena Madhumehatvam Apnayati. Acharya Sushruta says, Kalantarena all Pramehas will be converted in Madhumeha. But in Charaka Samhita Sutra Sthana 17th chapter, I read, Guru Snigdamla Lavanani Atimatram Samashnatam Navamannancha Panamcha Nidram Asya Sukhanicha Tekta Vyayama Chintanam Samshodanam Akurvatam Shleshma Pittam Cha Medascha Mamsam Cha Atipravardate Tairavrita Gadirvair Oja Adaya Gachati. This is the important samprapti of Madhumeha. Even if you see in Madhukosha commentary of Madhava Nidana, at the end of Madhumeha chapter, he says there are two types of Madhumeha. One is Kafavrita Madhumeha, another is Pittavrita Madhumeha. This Kafavrita Madhumeha and Pittavrita Madhumeha are curable Madhumehas, whereas other Madhumehas are not curable, they are only palliative, they are only activadis. So, Tairavrita Gatirvayuhu Oja Adaya Gachati. This is the concept of Avaranajanya Madhumeha Samprapti, which is told in Sutra Sthana 17th chapter. Kyanta Shirasi Adhyayam. This is the crown of explaining the diseases. Shirasiya is crown like upon the king's head there is a crown, and in the Charaka Samhita this chapter is like a crown. So what it is telling? The Pancham Madhumeha Samprapti it is told. When Madhumeha Samprapti is told, before explaining Madhumeha Samprapti, he is explaining Vyayamo Anashanam Chinta Rukshalpa Pramidashanam Vatatapo Bhayashoko Rukshapanam Prajagaraha Kafashonita Shukranam Malanam Cha Ativartanam Kalo Bhutopagatascha Gnatavya Kshaye Hetava. See, in 17th chapter he is telling Kshaya Hetus, which are the causes for making Kshaya. And he will tell Ashtadasha Kshayas before that. After explaining Ashtadasha Kshayas, he is explaining causes of Kshaya. See, uncontrolled thinking, Rukshalpa Pramidashanam, excessive diet controlling, and Kafashonita Shukranam Malanam Cha Atipartanam. I will be giving example for this. When patient will be telling, there are a lot of misconceptions in Vajikarana. In that people say that masturbation is normal, masturbation is healthy. This is told by modern psychologists. But Ayurveda says, Kafashonita Shukranam Malanam Cha Ativartanam. Shukra Ativartana is not normal. The masturbation or excessive sexual intercourse, both are going to cause Kshaya. Kshaya may be Rajakshma, Kshaya may be tuberculosis, Kshaya may be AIDS, HIV, Kshaya may be carcinoma. So these are all Kshayas. And even COVID-19 patients who will be at the end of their life, they look like Shosha and Kshaya. So because of Vyayamo, Anashanam Chinta, Rukshalpa Pravidashanam, Vatatapo, Bhayam Shoko, Rukshapanam Prajagaraha. See, Bhaya, Shoka, Chinta. All these are psychological factors which are causing pandemic disease spreading more. Kalo Bhutapagascha. Kala is one of the factor which is not in our hand. Kala is Kalo hi Bhagavan. Kala is nothing but the God. Kala is superlative power of the time. Bhutopagata is of Bhutopagata can be understood in two ways. Here I call Bhutopagata according to Chakrapani is Bhutopagata Pishachadi Upagata. So Bhutopagata may be Pishachadi Agata, that is Amanushopa and Pishacha, if you read, Pishacha means Pishitan Astiti Pishacha, who are living on eating the muzzle. The muzzle eaters are Pishachas. See the translation of the word Pishacha, who are muzzle eaters. See, in the wet market of Wuhan, you might have seen all are Bhutopagata. There, Bhutopagata is Pishacha. What is Pishacha? Muzzle eaters. The wet muzzle eaters are going to get first disease of COVID-19, SARS, MERS, all these G4 virus. So Bhutopagata is wet market induced spread of the most of the diseases. Currently, this bubonic virus is spreading from eating of mongoose. The people are eating all animals, and then there is lot of spread of viral pandemics. So Kiyanta Shirisi Adhyaya is a crown in the entire Samhita because it is giving lot of information like this. Kitta Rupasya Vatasya Anutpadat Kshayo Gneha. See, what is Kshaya here is, the Chakrapani comments on this. Anashanat Kitta Bhava. See, what happens because of Anashana, Kitta Abhava takes place. Kitta will not manufacture. And Tatascha, Kitta Rupasya Vatasya Api Anupada. In the metabolism, where Madhura Avasthapaka, Amla Avasthapaka, and Katu Avasthapaka takes place, Santatya Bhojyadhatunam Parivurtistu Chakravat takes place, and in Charaka Chikitsa Sthana 15th chapter, Professor C.P. Shukla was commenting on this. Many times he used to quote this shloka. What happens is this is Tatascha Kitta Rupasya Vatasya Api Anutpadat. Kitta Rupa Vata is manufactured in the metabolic process of Katu Avasthapaka. And that Kittarupa Vata should be in normal level. If it is not normal, then that is a cause for Kshaya Hetava. The Dushti of Kittarupa Vatasya Anutpatti is one of the cause for Kshaya. Whether it is Rajayakshma Janya Kshaya, or Carcinoma Janya Kshaya, or COVID-19 Janya Kshaya. All these Kshaya is explained in this 17th chapter. Of course, it will take a lot of time if I start explaining 17th chapter. One more example I want to give. Vatadinam, Rasadinam, Malanam, Ojasastata, Kshayastatra Aniladinam, Muktam Sankhina Lakshanam. See this concept of clinical material in this 17th chapter. Acharya Charaka says that Sankhina Lakshanam. It is a Kshina Lakshanas are explained when Vatadinam, Vatadi three doshas, Rasadinam, Saptadhatus, Malanam, three Malanam, Ojasastata. See, whenever we are doing clinical intervention and clinical protocol, whenever we are designing, every Kayachikitsa Panchakarma person and Samhita person should guide this. Vatadinam, Tridosha, Saptadhatu, Trimala and Ojas. That's why in Sutra Sthana Pashtanga Hridaya he says, Dosha Dhatu Mala Moolammi Shariram. He says, Dosha Dhatu Mala Moolammi Shariram. The same word is there in Charaka Samhita, Vatadinam, Rasadinam, Malanam. But Vagbhata has left Ojasastatha. Vagbhata says, when I have explained Saptadhatus, Saptadhatusara Ojas is explained. That's why Dosha Dhatu Mala Moolammi Shariram. This is a link between, this is my concept, this is a link between Charaka Samhita Sutra Sthana and Ashtanga Hridaya Sutra Sthana. Ashtanga Hridaya Sutra Sthana is a direct clinical textbook where the philosophy of medicine in Charaka Samhita is having a basic explanation that whenever you are seeing a disease, which is a known disease or unknown disease, one must understand the involvement of Vatadi Tridosha, Rasadi Saptadhatus, Sweda Adi Malas, three Malas, and Ojas. You should calculate these four in Dosha Dusha Pariksha. Dusham Desham Balam Kalam Prakritim Manalam Vayaha. All Dasha Pariksha we do before administering the medicine. These Dasha Parikshas should be targeted on the broad headings of Vatadinam, Rasadinam, Malanam, Ojas, etc. Based on this only we should try to understand. If we can read Charaka Samhita Sutra Sthana 17 chapters, this sloka, in this last shloka, that is 119th sloka, Nityam Sannihita Matimatram, Samikshamatmanam Atmavan, Nityaha Yuktaha Paricharet, Ichat Na Ayuhu Anitvaram. So this shloka is going to tell you for Atmavan this chapter is told. Nityam Sannihitam Amitram Samiksham Atmanam. This is the Sara of the book. What it is telling is, I am telling all these for Atmavan Purusha. So what is this? Prakritastu balam sleshma vikruto mala uchyate. So Prakrita gati of sleshma is bala, and Vikruta gati of kafai is mala. So we should understand the gati of doshas. Vatasya gati, pittasya gati, kafasya gati. Sachaiva Ojas smagaha kaye cha papmam udirate. What is this is Prakrita Sleshma is Bala and Prakrita Sleshma itself is Oja. Sachaiva Ojaha kaye. In the body, what is the Ojas? Ojas is nothing but Prakrita Gati of Kapha. Prakrita Sleshma is Bala and Prakrita Gati of that Sleshma is Ojaha. So the immunity is nothing but Prakrita Kapha. Actually, we are telling that Pitta Pangu, Kafa Pangu, Pangavo, Maladhatoha, Vayuna, Yatra Niyante, Tatra Gachanti Megavati. Here, what is happening is Vayu is Prabala dosha, that's why we are neglecting Pitta dosha and Kapha dosha. Whereas in case of Ashaya Pakarsha Hetu, like in Kamala only, we think about Ashaya Pakarsha Hetu that the Vayu is forcibly taking Pitta and Kapha dosha and putting into the Pitta Sthana and Kapha Sthana, Tvacha and Ashayas. So there is Kamala Samprapti. Ruddhapata Kamala is explained in this Ashaya Pakarsha. Actually, the Charaka Samhita is interested in telling Sarvahi Cheshta Vatena Sa Pranaha Praninam Smitaha. All the force, power, and liveliness, and all the activities, all the Chetana. Cheshta is Chetana. All the Chetana yukta activities are due to Vata dosha. Tenaiva roga jayante, tenaiva uparudyante. Vata is responsible for manifestation of all diseases. Vata is responsible for cure of all diseases. So my question is, or my suggestion is, whenever you are doing a drug design for a pandemic disease, have you focused on Vata dosha? Have we focused on Vata dosha? Because this droplet infection, viral infection by communication, that is, if you not follow the distance, social distance, the COVID-19 will spread. So distance is Vata dosha. Maintaining the distance is Vata dosha. Not maintaining the distance will cause again Vata dosha. So tenaiva roga jayante, tenaiva uparadhyante. Vata dosha is responsible for spreading of COVID-19 like pandemic diseases, and if you control Vata dosha, automatically the disease will be controlled. Are we trying to do Vata Hara Chikitsa in our COVID-19 management? So the diet, drug, or intervention should have some Vata Hara Chikitsa, should have some Kapha promoting Chikitsa, because the Prakrita Sleshma is Bala and Prakrita Bala is Oja. So this concept of Kiyantashirisiya, I want to highlight. Of course, I cannot do all 30 chapters in detail, but some of the very important aspect of Kiyantashirisiya I want to highlight, so that even Chakrapani you see, Balamiti Balahetutva. What is the Bala is the muscular strength as well as immune strength. Both are explained by Acharya Chakrapani. What is Oja? Acharya Chakrapani comments here in this shloka number 117 of 17th chapter. Oja iti sarabhutam. Oja is the essence, the total essence part of all human body. What is that? Our cytoplasm, our protoplasm, our DNA. That is sarabhuta. You should think sarabhuta of the body is DNA. So you see the RNA virus is hitting. That's why we are not understanding a easy breakthrough in vaccination. Of course, vaccine is coming. They are telling it is coming and it is taking time. The virus RNA will be always changing. That's why HIV's RNA strands have been changed. So vaccination is very difficult when RNA changes in a virus. So Oja iti Sarabhutam. Oja is not a simple thing. Oja is Sarabhuta of the Sharira. That is the prana. Sarabhuta of the prana. DNA is Sarabhuta. Cytoplasm is Sarabhuta. Protoplasm is the Sarabhuta. So this Sarabhuta part of the whole body is Ojas. And Chakrapani continues, Yadiva Ditiya Slaishmiko Ojo Hetutvena Ojaha. One part of understanding Oja is Sarabhuta Oja. Another part of second thinking of Oja is Yadiva. He says Yadiva. Otherwise, in another way, Dvitiya Slaishmika Ojaha Hetutvena Ojaha. Slaishmika Oja is a Hekarupa Oja for our body's maintenance and destruction. So what is happening? Tacha pittam prakritim vikaran kurute bahun. Pitta deva ushmanaha. Bhaktihi naranam upayijyate. If you see in Vatakala Kaliya, the normal pitta bestows health, abnormal pitta causes disease. Normal vata gives health, abnormal vata causes disease. Normal kapha gives health, abnormal vata gives diseases. That's why sarvahi cheshta avikruta gamanadhyaha uparudyate mriyate. See the Chakraparni's clinical comment, very beautiful comment. He says, Dukkha hetutvat papma. After that, very good commentary of Chakrapani in this Prakritagati and Vaikritagati. Actually, Prakritagati and Vaikritagati is not a line of movement or a direction of movement. This is the mechanism of action of Vata Pitta Kaphas and Ojas in the body. That's why Chakrapani says, Sarvahi Cheshta Vatena Sa Pranaha Praninam Smurta. Sarvahi Cheshta. Cheshta is Praninam Pranamataha. Vata is Praninam Prani. And Cheshta is Praninam Prana. See, I make understanding of this line in two ways. Sarvahi Cheshta Vatena. Sa Praninam Pranaha Smritaha. The Praninaha Sarva Cheshtaha Pranaha. Praninaha Sarva Vata Pitta Prakrita Gati is Cheshta. If Vata Pitta Kapha's Vikruta Gati is there, that is not Prana. Vata Pitta Kapha's Prakrita Gati is to be understood. And one more thing in Rasa Shastra and Vaishyaja Kalpana research, in Maharashtra Sampradaya, they talk about Aushadhi Gati. They talk about Aushadhi Gati. That is also one Gati. And Sachaiva Vojaha Smrtaha. When the Cheshtas are Avikrita Gamanadihi, Vikrita Gamana is going to cause disease, Avikrita Gamana going to cause the health. I was talking about cytokine theories in the current pandemic. See, cytokines are good and cytokines are bad. So, Ojas is good for body, Ojas is going to cause bad for body. The Vata Pitta Kapha's Prakrita Gati is good for body, Vata Pitta Kapha's Vikrita Gati is bad for body. There are two activities of cytokines. Cytokines are important enzymes released in the body because of the defense mechanism. By the white blood cells, the cytokine activity starts. So T lymphocytes and B lymphocytes have got, the T lymphocytes have got this cytokine controlling mechanism. The inflammatory cytokines are responsible for killing the COVID-19 patients. Make it clear. The Vikruta Gati of cytokines is responsible for killing the patients, whereas anti-inflammatory cytokines present in the body are going to save the patient from the cytokine damage. So we are supposed to make, when in pro-inflammatory cytokines are released, when anti-inflammatory cytokines are released in the body. See, the fear of the cytokines is releasing pro-inflammatory cytokines. If you are having Sattvavan, if you are having Dhivan, if person is having Dhairya, then anti-inflammatory cytokines will be released. Actually, there is a clinical trial in the Western world. Some of the patients are having antibodies who don't have travel history, who don't have primary contact, who are not quarantined. But their random blood sampling demonstrated that COVID-19 antibodies are present in the person who is not exposed to COVID-19 virus. He is healthy. He has not got any contact with COVID-19 patients or primary contact. He is not in a quarantine area. Then why these antibodies for COVID-19 virus is there in the blood? It is because my hypothesis is, if you are having a fear of this COVID infection or viral infection, with that fear, human body starts giving signals from the brain that the body starts manufacturing antibodies for COVID-19 virus before the virus enters to the body. With great respect to my guru, like the Srikant Bhagavadikar of Pune, Mumbai, Solapur, this concept of understanding cytokines and enzymes and hormones, they are just released because the Ojas Vikrita Gati is there. The patient is afraid that when we did lockdown in the lockdown one, people started getting fear. They were afraid of the lockdown concept. And when they were in the house for 3 months, they were having lot of anxiety, fear, and apprehension. Due to that, human body started signals from the brain. Brain is the important organ in the body to manufacture and give guidelines to the T lymphocytes and B lymphocytes to manufacture anti-inflammatory cytokines and antibodies for in future coming virus. See, the virus has not yet come to me. In the first lockdown itself, our body started manufacturing the antibodies. That is anagata bada pratishedam. That's why tenaiva roga jayante tenaiva uparadhyante is prana, is vata, and vata is present in brain. Pranavata is present in the brain. Pranotra murdaga. The pranavayu which is present in the murda is going to control all other panchavatas, and in coordination. Tenaiva roga jayante, tenaiva uparadhyante. This shloka I always repeatedly talk because where is the concept of new disease understanding means this is here. The shloka what I quoted from 17th chapter, that is 63rd shloka. Vatadinam, rasadinam, malanam, ojasattata, shaya tatra aniladinam, muktam sanchina lakshanam. The Kshina Lakshana is given importance in Sutra Sthana 17th chapter of Acharya Charaka, whereas in Sutra Sthana of Ashtanga Hridaya Doshadi Vijnaniyam Adhyayam, there Vruddha doshas will cause more disease, but here Acharya Charaka is telling Kshina doshas will give more important diseases. Kshaya hetus are going to cause more diseases. So Kshaya cannot be ruled out. Vatadinam Kshayaha, Vatadinam Vikratagatihi. रसादीनां क्षयः रसादीनां विकृतगतिः मलादीनां क्षयः मलादीनां विकृतगतिः ओजसः क्षयः ओजसः विकृतगतिः. This interpretation is important pathophysiological concept for understanding COVID-19 like new diseases coming in the market. I also quote in this chapter only, if you read Charaka Samhita shloka number 60, same Sutra Stana 17th chapter Kiyanta Shirsi Adhyayam, shloka number 60. Before telling Samchina Lakshanam, before telling Kshaya Hetuva in 77 shloka, Acharya Charaka says one more beautiful shloka, that Vatasleshma Kshaye Pittam Dehojaha Samsayan Chare Glanim Indriya Daurbalyam Trishna Murchan Priyakshayam. I repeat this shloka number 60. Vatashleshma Kshaye Pittam Dehojaha Sramsayat Chare Glanim Indriya Daurbalyam Trishtam Murcham Priyakshayam. See the beauty of Dehoja concept. See, Dehoja concept Pitta, what is Pitta is doing a Vikritagati. What is that Vikritagati? Dehojaha Sramsayat. Pitta is doing Dehoja Sramsanam. See, what is the normal guna of Pitta dosha? Pittam Sasneha Tikshnoshnam Lagu Visram Saram Dravam. This Saraguna and Dravaguna of Pitta dosha, when Vatakafa Kshayavastha is there, it is doing Dehoja Sramsayet. Dehoja will be having Vikrita Gati. Then Glanihi, Indriya Daurbalyam, Trishnam, Murcham, Kriyakshayam. This is COVID-19 ICU Lakshanas. This will happen when Dehoja Sramsana takes place. Dehoja Sramsana, when Vata Kapha Kshaya is there, it is Vata Kapha Kshaya, Pitta Sramsana Lakshana, It is a Vikrutagati, and it is going to cause very critical illness due to the Dehoja Sramsana. And if you see Charaka Samhita's same 80th shloka, where I was quoting about Madhumeha Samprapti, shloka number 8 is, I will read again, Sleshma Pittam cha Medascha Mamsam cha Ativardate, Tairavrta Gatir Vayuhu, Oja Adaya Gachati. Again, this is Oja Adaya Gachati. This the hetu here is once again Oja Adaya Gachati. And if you read in Chikitsa Sthana and Nidana Sthana Prameha, Rasascha Uja Saha, Rasascha Rasauja is also involved in Prameha Samprapti, Dehauja involved in Madhumeha Samprapti, Taira Uta Gatirvayu, Oja Adaya Gachati, and then this Vikrutagati of Oja, Vikruta Sleshma, Vikruta Bala, Vikruta Oja is going to got Tenaiva Roga Jayante, Tenaiva Uparudyate. This is a basic principle approach, Samhita Siddhanta department approach, Charaka Sutra Sthana's approach for understanding COVID-19 like diseases which are pandemic in the current market. So, what is the line of treatment? Opposite for that is the line of treatment. So, that's why he says, Nityam Sannita Mitram, Samiksha Atmanam Atmavan. What you do is Samiksha Atman. You examine yourself if you are Atmavan Rogi. So the public should be educated that they should examine themselves whether I am having immunosuppression like lakshanas, whether I am having Vata Pitta Kapha Dutti lakshanas, whether I am having Ojas Ramsa lakshanas, whether I am having Mala Dushti lakshanas, Vibandha, Atisara, Adi Mala lakshanas, Kapha Kasa, Kapha Udhuyana lakshanas, Angamardha, Vata Vriddhi lakshanas, Shirashu lakshanas, Agnimandya lakshanas. If these primary lakshanas based on Charaka Samhita Sutra Sthana 17th chapter are observed by the patient, if patient cannot understand, please the delegates participated today from the Department of Basic Principle, Kaya Chikitsa and Panchakarma, make a list of these lakshanas and give a format to the patients in public, house to house, door to door, you do a survey and tell them if they feel these lakshanas in their own language, you give them a short list. If they feel these lakshanas are available, then you give Kapha Prakriti Karana Chikitsa, Agni Prakriti Karana Chikitsa, Oja Prakriti Karana Chikitsa, or Vata Prakriti Karana Chikitsa. This is very important. How to make Vata normal, how to make Pitta normal, how to make Kapha normal. Instead of going to the more complicated line of treatment which are trained in MD Ayurveda or PhD Ayurveda, a common man should be given a line of thinking for COVID-19 Samprapti of 17th chapter that Bastir Vireko Vamanam Tata Tailam Grutam Madhu. See, Acharyas are telling two line of treatment. Bastir Vireko Vamanam. This is for qualified MD Ayurveda, BAMS graduates line of treatment in COVID-19. Whereas Tata Tailam Grutam Madhu. This is home remedy. They break this shloka into two parts. The first half is for qualified BAMS and MD doctors and Panchakarma experts or Kayachitsa experts. Whereas second half of the treatment is Tata Thailam Grutam Madhu. Give direction to the public by the media, by the WhatsApp group, by the television channel, by the FM radio channels that Taila Gruta Madhu. They should take Murchita Taila, Murchita Sarshapa Taila, Katu Taila Prayoga. Application over the Shirashravana Padeshu Tam Viseshena Shilet. Abhyanga should be done specifically on Shirashravana Padeshu. I give my commentary like this: Shira, Nasa, Shravana, Akshi, Nabi, Padeshu Tam Viseshena Shile. Because the spread of COVID-19 is through Akshisrava, Nasasrava, Karanamala, Asasrava. The Abhyanga with Murchita Taila or Murchita Katutaila, Sarshapa Taila should be done on this. So then what is a normal gati takes place? So then Tenaiva Roga Uparudyante. By application of Taila over the Shiras, Nityam Acharet Abhyangam over Shiras, over Akshi, over Nasa, over Karna, over Asya, that is gargling or Kavala Gandusha with Taila, Murchita Taila, or even Tila Taila, or even cooking oil. If person start doing this Nehana Karma, in their home, then definitely they start getting Vatasya Samanya normal Gati. Vatasya Vikrita Gati will be controlled by home remedy, which is Gatischa Dvida Drishta Prakriti Vaikriti Gati. Shira is Pranavata Sthana, Indriyayatanam Uttamam, all endocrine secretions, all neuronal signals, all these hypothalamo pituitary gonadal axis or hypothalamo pituitary thyroid axis will definitely take their origin from the brain, and then the patient can recover. Ghrutam. They can take 1 spoon ghruta in their food. What is wrong in that? By giving ghruta into the body, it is yoga vahi. Vatahara, Pittahara, Kapahara. It is Nati Ushna Viryam. It can do yoga vahi karma. It is Vata, Pitta, Kapha Gati will be normalized by administration of ghruta in their food. So then Shuddha Ghruta in the diet can be advised. And Madhu, why not? A simple 1 spoon of Madhu without any hot water mixing. See, I always condemn hot water and Madhu drinking is not Ayurvedic concept because it is Viruddha. So only Madhu, 1 spoon Madhu in the morning, 1 spoon Madhu in the night. From the day one neonatal baby to the old age people or who are in the ICU. In the ICU, you can give 1 spoon of honey in their rice stew, 2 spoons of honey in their rice stew as one of the dietary supplement mixed with plain water. Then tata tailam grutam madhu. It will cause rasadinam, maladinam, vatadinam, ojasasya tatha. The kshina of vatadinam, rasadinam, maladinam, ojasasya tatha. 63rd shloka will be improved and Dehoja will be improved. Sramsana of Dehoja will be controlled. Tairavrata Gatirvayuhu Oja Adaya Gachati. By administration of Taila Gruta Madhu, the normal samprapti takes place. The Vatapitta Kapha's normal Gati will establish. Sachaiva Oja Smritaha. Prakrita Kapha is Bala, Prakrita Bala is Ojas, and that Ojas will cause Vatapitta Kapha's normal Gati. Sarvahi Cheshta Vatena Sa Pranaha Praninam Pranaha Smritaha. The shloka number 117 also 118 also will take place, and like this we can make a COVID infected person as Atmavan. He can introspect himself and take the administration of Tata Tailam Grutam Madhu along with any of your drugs. Now the rate of Ashwagandha will rise, rate of the Guduchi will rise, and the rate of the Gruta Tailam Madhu will be raised. Whenever we tell Guduchi is very good for health in COVID-19, Guduchi rate will substantially increase in coming days. Tulsi's rate will substantially rise in the coming days. And any drug you tell, Guduchi, Tulsi, Haridra, Pippali, Maricha, all these rates, commercial rates will definitely jump 30%. So rather than doing that, educate the patient. Atmavan means educate the patient. Nityam hitahara vihara sevi samikshakari hrideshu saktaha data samas satyapara kshamavan atmopasepi sa bhavatya rogaha. Same Bhagavad Gita's concept is accepted in Ashtanga Hriday. So Asam Runnabi Vastijaha Paripakwaha Sannipataki Chamarnaya. If all three doshas combine together, they will cause damage. This COVID-19 infection is a Tridosha Vyadhi. That's why the person should understand the free radical concept is also explained in this concept. In this Kiyanta Shirasi Adhyaya, there is Amotpatti. Amotpatti takes place because of वातादयः प्रकुप्यन्ति शिरसि अस्रं च दूष्यति ततः शिरसि जायन्ते रोगाः विविधलक्षणाः. See shloka number 11 in 17th chapter. Uchairbhashyad avashyad pragvatat atimaitana. Pragvatat. See, Pragvata is responsible for these diseases in Kenta Sharasiya. Pragvata is coming from east states or eastern countries to India. You know what is the eastern country for India? From the eastern countries only COVID-19 has come. So pranaha pranavadam mitra sthitaha sarvendriyani cha yadattamanganam manganam shirastadvidiyate. So the amopatti is nothing but free radicals delivered in the body due to the tridosha prakopa and due to the rasadinam, maladinam, vatadinam, ojasastata vikritagati. The vikritagati of Agni, vikritagati of Pitta is going to cause the liberation of free radicals, and free radicals will damage or cytokines will damage, pro-inflammatory cytokine will damage interleukin 1, interleukin 6, or TNF alpha, all these are released due to the amadosha in the body. Why amadosha is manifested? Amadosha is manifested due to the following of Kshaya Hetava. What is that? Vyayamo, Anashanam, Chinta, Rukshalpa Pramidashanam, Vatatapo, Bhaim Shoko, Rukshapanam Prajagaraha, or Sandarana, Divasupnat, Ratro, Jagaranan, Mandat, Uchair, Basha, Daya, Avashat, Pragvata, Datimaitana, Gandha, Asatmyad, Gnata, Rajo, Dhuma, Himatapat, Guru, Amla, Haritadayanamati, Shitambu Sevana. Even people in the rainy season drinking cold water, even in the rainy season you are taking Guru Amla Harita Ati Sevana. The Charaka Sutra Sthana 17 chapter 9 and 10, 8, 9, 10. These are going to cause Amotpatti, and due to the Amotpatti there is Dosha Dhatu Mallas getting Vikritagati, and due to the Vikritagati Tairavrtagati Vayuhu Oja Adaya Gachati Sachaiva Roga Jayate. Vata dosha pradhana tridosha prakopa is going to cause sannipataja jwara or punaravartaka jwara, or even agantuja aupasargika jwara, or there is shasanaka sannipata jwara, kafavata pradhana sannipata jwara, or COVID jwara. I call this COVID-19 as a new terminology called COVID jwara. This COVID jwara is due to the not understanding Kiyanta Sharasiya Adhyayam, not getting the applied aspects of Kiyanta Shirasiya Adhyayam. If you get Kiyanta Shirasiya Adhyayam of Sutra Sthana of Charaka, you will get a thinking towards or insight towards understanding Kovida Jwara, Kovida Jwara Janya Shwasa, Kovida Jwara Upadrava causing Mrityu. Kovida Jwara has become Janapadodvamsam. In this way, we can understand the Kiyanta Shirasiya Adhyaya. I can go fast for further few slides. See, Ashtodhari Adhyayam giving you the classification of diseases. Maharoga Adhyayam is also giving the disease caused by single vata, that is Nanatmajavata Vikaras. Ashtav Nindita says endocrinology concept, and Langana Brahmani Adhyayam, it is one of the important most chapter. Without knowing this 22nd chapter of Charaka Samhita Sutra Sthana, Panchakarma practice, Kaya Chikitsa practice cannot develop. So a delegate who has participated should understand this Langana Brahmana Adhyaya followed by Santarpani Adhyayam. 23rd chapter is an important guideline for all obesity, endocrinology diseases, or even Santarpana Janya Vyadhis, or the all current diseases like Prameya Pidika, Kota, Kando, Pandvamaya Jwaraha, Pushtani, Amapradoshascha, Mutra Pitram Marochakaha, Tandra, Klaibam, Matistaulyam, Alasyam, Gurugatrata, Indriya Srota Samlepo, Buddher Moha, Pramilakaha, Shofam, Tadevane, Shigram, Apratigurvata. If these Santarpanajanya aharas like Snigdaihi, Maduraihi, Guru Pichalaihi, Navannapana Madhyasi, Mamsaihi, if these aharas are taken, Santarpanajanya Vikaras, Charaka Sutra Sthana, 23rd chapter, Shloka number 4, 5, 6, 7 will come. Very important line of treatment for the COVID-19 is also having Santarpana Janna Vikar. It is not having more Apatarpana Lakshanas. So, for that, what we do is Chuna Pradeha cha Echa Uktaha Kandu Kota Vinashanaha. Sakshodram Abhayaprashaha. Very important Rasayana Prayoga for the Santarpana Janna Vyadhis, obesity, diabetes, hypertension, hypothyroidism, or syndrome X. For all of them is Sakshodram Avaya Prashaha. Haritaki with Madhu Prayoga is a very important Prayoga. Or even you can take another Prayoga is Trifalam Aragudam Patam Saptaparanam Savatsakam Mustam Sa Madanam Nimbam Jalana Utkatitam Vive Tena Mehadayo Yanti Nasham. See this Trifaladi Kashayam, Trifala Aragvadiya Kashayam is effective in Madhumeha, hypertension, Upalepa, Shonitaja Roga, Brukkaja Roga, Mutraja Roga, and Kovida Jwara, Sannipata Jwara, or diabetes patient having Kovida Jwara, and diabetes hypertension Hudroga patient having Kovida Jwara, or hypothyroidism patient having Kovida Jwara. For all of them, this Trifalam Aragudam Patam Saptaparanam Savatsakam and Mustam Madanam Nimbam Zalena Utkaditam Vivet. This is from Professor U.D. Raval of Ahmedabad Ayurvedic College. He was quoting about this when 20 years back. These Musta Aragvadadi Kashayam, all these things can be used in the place of COVID season when Santarpanajanya Vyadi person is getting COVID, or diabetes, hypertension, heart disease, or hypothyroidism patient who are getting COVID Jwara. 23rd chapter gives important clues for management of diseases. In 24th chapter, Vidishoniti Adhyayam, we are getting Sannavasroto Vikaras. The complication of COVID Jwara can be understood in this. Saktanam Alpadrutalabam Chalastu Akhilat Cheshtitanam. Some of the Saktu Prayogas are told, some of the Payasas are told. Shilayaha Prayogova Sagruta Kshaudra Sharkaraha, Shilajatu Prayogova Prayogaha Payasopiva, Trifala Prayoga with Madhu Gruta Sharkara, or Shilajatu Prayoga, or Payas Shilajatu with Kshira Prayoga. One of the best rasayana for complicated symptomatic COVID patients is Shilajitu Prayogaha Sa Payasopi. Pippalinam Prayogava Payasa Chitrakasyava. Pippali Kshirapaka Vardhamana Pippali Rasayana with Payas. That is Charaka Sutra Sthana 24 chapter 56 and 57 sloka. And Chitrakasya Prayogava. See Chitraka with Kshira, Pippali with Kshira, Trifala with Madhugruta Sharkara, Shilajitu with Sharkara. These five Rasayana Prayogas of 24th chapter are effective in the Vidishonitya Adhyaya, which are useful for any advanced cases of COVID-19 patients. In Ejjapurushi Adhyaya, it brings important perspective of 155 Agri Aushadis. This is Agri Aushadhi Adhyaya. Single drug choices can be taken. Food and drugs can be selected from this chapter. Atreya Bhadrakapi Adhyaya gives lot of discussion on Rasa, Virya, Vipaka, Prabhava, Jataragni, and it is also explaining on Viruddha Ahara. In Viruddha Ahara, this very important explanation I was telling about what is the wrong thing in taking Viruddha Aharas, the Klibatvam, all disease will come. So, in this way, Shandyam, Andyam, Visarpam, Udakavaranam, Vispoto, Unmadaha, Gagandaram, Murcha, Atmanam, Galagrahanam, Pandvamayam, Vishasyacha, Ama Vishajanya Rogas are coming due to the Viruddhahara. This Ama Visha is nothing but the drug-induced intoxication. And in COVID season, people are eating this and that roadside food products. They will get Ama Visha Lakshanas. Then Ama Visha Lakshana should be treated based on the Annapana Vidhi Adhyaya. So in Annapana Vidhi Adhyaya, wide variety of food and beverages is explained. In Vividha Ashita Piti Adhyayam, the important aspect of Vedic Shamatva comes in this 28th chapter. Aglivesha asks one question to Atreya Punarvasu that, Sir, even though some are not doing Patyapalana, they are not getting disease. Some are doing Patyapalana, they are getting the diseases. So then what is the fun in doing Patyapalana? Then Acharya Charaka says, Nahi Sarvani Sharirani Atma Nahi Sarvani Api Patyani Tulya Doshani Sharirani Tulya Doshani Nacha Sarve Doshaha Tulya Balaha Nacha Sarvani Sharirani Vedic Shamatve Samarthani Bhavanti. Shloka number 7 of 28th chapter gives one of the best direction for immunological theories of Ayurveda. And Acharya Chakrapani says, comments on this, that Vedic Shamatve Samarthani Bhavanti. Vedic Shamatvam is of two types. One is Vyadi Bala Virodhitvam, another is Vyadi Utpada Pratibandhaka Samartham. We are thinking that before onset of the disease, Vyadi Utpada Pratibandhaka Rasayana should be given. Vyadi Utpada Pratibandhaka Rasayanas are like Guduchi, Shatavari, these are all Vyadi Utpada Pratibandhaka Rasayanas. Whereas Vyadi Bala Virodhi Rasayanas are very powerful Rasayanas like Shilajatu Rasayana, like Ballataka Rasayana, Sahasra Ballataka Vritam, Ballataka Dasha Prayogam, and the Arushkara Prayogam. Ballataka, there is Gugulu Tiktakam Kashayam, Gugulu Tiktakam Vritam, Chincha Ballataka Vati, and even Sanjeevani Vati. There are different patas of Sanjeevani Vati. In one pata of AFI, only Vatsanabha is present and Ballataka is absent. Whereas in case of Sharangadara, there is Ballataka as well as Vatsanabha, both are present in Sanjeevani Vati. See, Samshavani Vati is Vyadi Utpada Pratibandhaka Rasayanam. Whereas Sanjeevani Vati is Vadi Bala Virodhi Rasayana. Sudarshana Ganavati, Sanjeevani Vati, and Samshamani Vati. These three Vatis, if you give, this is very effective line of treatment for the COVID-19. Before onset, Samshamani Vati, Guduchadi Kashayam, or Nagaradi Kashayam. Once the patient is affected with COVID-19, Sanjeevani Vati, Ballataka Vati, or Ballataka Grutam. Now, Ballataka Grutam is available in the form of capsule. If Pippali Vardhamana Rasayanam is for symptomatic patient as Vadibala Virodhi Rasayanam. And Shilajitu Rasayanam, Paisa Shilajitu is Vadibala Virodhi Rasayanam. So, like this, we can think about the applied aspect of Sutra Sthana 28th chapter 7th shloka. Chakrapani commentary can be taken for Vadik Shamatva Janna Vikaras. In 29th chapter, Dasha Pranayataniyas are explained. Prana resides in the body. So, attributes of a Prana Visarana Vaidya and Roga Visarana Vaidya, the qualities are explained. So, one who are, and the 24th chapter is Rasayana Kalpas. Trifala Rasayana, Shilajitu Rasayana, Ballataka Rasayana, Pippali Rasayana, Chitraka Rasayana. Or people are using Medya Rasayanas. All these people are Pranabhisara Vaidyas. Whereas people are doing trials on human beings with some of the new drugs or some of the HCQ like drugs where it is causing, using of HCQ causes heart attack rate increase. So they are all Rogabhisara Vaidyas. So we should not do harm to the patient. In Arte Dashamahamuli Adhyaya, the heart and the heart related 10 major vessels are explained. The definition of Ayu is explained, and then 4 types of Ayu's synonyms are explained. Ayurveda, aim of the Ayurveda, Tantrasya Prayojanam, Dhatu Samya Kriya Chokta, Tantrasya Prayojanam. Ayurveda Prayojana is not treating doshas, it is not Samshodhanam, it is not any drug given, it is Dhatu Samya Kriya. So, Rasayana Prayoga and nutritional food supplementation Prayoga, Vega Dharana, controlling of Dharaniya and Adharaniya Vegas calculation, and Sadvrutta Paripalana, Dinacharya Rutucharya Palana is actually the Prayojana of Ayurveda. So, with this, I think we can conclude today's talk. I hope I have concluded the total picture of Charaka Samhita I have given. The carry home message is read 17th chapter, 24th chapter, and 28th chapter more for understanding current pandemic diseases, Samprapti, and accordingly the treatment procedures, Dehoja Samsana takes place. For that purpose, we should take the involvement of Rasayana Prayoga told in 24th chapter, and 23rd chapter is Trifala Aragvidadiya Kashayam or Tata Tailam Grutam Madhu. So from Sutra Sthana only we can treat COVID-19 infections. With this, I conclude my talk. I am thankful once again to Principal Dr. Gajanan Hegde, Mysore Government Ayurveda College for giving me an opportunity. All the teaching faculty of Government Ayurveda College, Mysore, and Samhita and Siddhanta department in particular, the head of the department, Dr. Srivatsa, all the teaching faculty of Samhita Siddhanta department, in particular Dr. Vasudeva Chate, all the PG scholars, UG scholars, and my dear students. And thank you one and all for giving me an opportunity and your patientful hearing. If any good thing is there, it is all because of my Gurujis like Professor C.P. Shukla, Gurudev Singh, Srinivas Hejmadiji, Dr. Bunny Gold, Dr. Prashant, Dr. Niranjan Rao, and all my senior friends. And my patients have taught me many things. And I'm thankful to Charaka Samhita, Agnivesha, and even Chakrapani, all the commentators. And with great thanks to my parents and my students. And I am also thankful to our college principal, for Dr. Sayyidatar Fatima Madam, for giving me time and permission to participate in this webinar. Thank you one and all.
Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. When we Guru and Guru like you, definitely will achieve success and goal. Thank you, sir. Thank you so much for delivering a wonderful speech on Sutra Sthana and its application in Chikitsa and enriching our student knowledge and also applying the Charaka Samhita to present pandemic disease, that is COVID-19. I remember your one lecturer in Nagur College where you delivered 6 hours lecture on Sa eva Kupta Samuthana Visheshataha. Sir, I remember now also, sir. Thank you, sir. Thank you for your busy schedule. In your busy schedule and COVID warrior duty schedule, enriched our student knowledge, and we are blessed to hear you in on air. Thank you, sir. Thank you so much. Now I request Anshu Sharma, please deliver a vote of thanks.
A very good afternoon to everyone joined here. I am Anshu Sharma of GAMC Mysuru. It gives me an immense pleasure to deliver the vote of thanks to all the dignitaries present here for today's webinar. Firstly, I would like to thank Dr. Madhava Diggavi sir for enriching our knowledge and inspiring our minds by his powerful words. As it is mentioned in the first chapter of Charaka Samhita Sutra Sthana, Tasya Ayushah Punyatamo Vedo Veda Vidam Matah Vakshate Yammanusyanam Lokayor Ubhayo Hitam. According to this, Ayurveda is the most exalted of all the Vedas and that which is said to be good for humans for both the worlds, that is the afterlife of human beings and the present life of human beings. His way of elaborating each and every aspect of Charaka Samhita reflects his deep interest in the subject, not just the theoretical part but also the clinical applications by relating it to the current COVID crisis were told by Sir. Sir not only enlightened our minds with our knowledge but also gave clarification to our doubts. We will be very grateful to you, Sir. I would also like to thank our principal, Dr. Gajanan Hegde Sir, for giving an opportunity to conduct this event. I would also like to extend my thanks to Dr. Srivastava sir for his guidelines and Dr. Vasudev Chattu sir for organizing this highly impactful event. I would like to thank Dr. Ramesh sir and Dr. Ashwini ma'am for their coordination and support. And I thank the teachers of GAMC Mysore and the PG scholars of GAMC Mysore and TGAMC Bellary for joining in this session. And last but not the least, I thank my friends for making this webinar successful by their presence. Once again, I thank one and all. Thank you.
Yeah, namaste, Chate.
Thank
Vasudev
you, sir.
Chate ji.
Thank you so much, sir. ಸರ್
Okay.
ನಾನು ಹೇಳಿದ್ನಲ್ಲ ಸರ್ ನಿಮ್ದು ಆ ಸ್ಪೀಚ್ ನನಗೆ ಇನ್ನೂ ಮರೆಯಕ್ ಆಗಲ್ಲ ಸರ್, ಅದಕ್ಕೆ ನನಗೆ ಇವತ್ತು ಗೊತ್ತು ಕೇಳಬೇಕಾಗಿತ್ತು ಸರ್. ನಿಜವಾಗ್ಲೂ ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಸರ್. ಥ್ಯಾಂಕ್ ಯು
Okay. Leave the session.